from natural sources. He has a PhD in medical endocrinology from Indian Institute of Science, Bangalore, and he is a member of Indian Association for Cancer Research. We are happy to have you here with us today, sir. Our second chairperson is Professor Vijay Rani Rajpal. She is professor at Department of Botany, Hansraj College, University of Delhi. Her areas of interest are cytogenetics, molecular markers application, population genetic analysis, and phylogenetics. Professor Rajpal has a PhD in botany from Department of Biotechnology, Department of Botany, University of Delhi. A postdoctoral research scientist she was at Department of Botany again. She had been a lecturer of botany at Acharya Narendra Dev College, University of Delhi. She was awarded 33rd Dr. Radha Krishnan Memorial National Best Teacher Award in the year 2017 for exemplary contribution in the field of education. She is also a recipient of Bharat Ratna Dr. APJ Abdul Kalam Memorial Grace India Best Teacher Award, which was given to her in October 2018. She was also awarded Grace India Best Researcher Award in 2018. She is a member of New York Academy of Sciences, USA, and has edited 4 research books and authored 4 book chapters of national and international publishers. She has published 20 scientific papers in peer-reviewed international journals. With this brief introduction, I welcome Professor Limaye and Professor Rajpal to chair this session and initiate the proceedings. So all the presenters, they get 10 minutes to present. After 8 minutes, they will be reminded that 2 minutes remain, and after which I will again inform that the 10 minutes are over, following which there will be a short Q&A session. All right.
Good afternoon, everybody. So on behalf of the organizing committee, we welcome you to this session. So it's a young brigade of, the upcoming scientists of India. So it's great to see you. We have come a long way since the time of phytochemicals like morphine, vinblastine, and others. They found a use in treating various disorders related to humans. And nowadays, as I attended a session in the morning, that we have a whole field of Ayurvedic genomics coming up, which is sponsored by Ayush. So we have, a lot of opportunities for drug discovery and alternate system of medicine, especially related to phytochemicals. And you can definitely contribute immensely, and you can carve a niche for yourself. So I welcome you to this session and wish you all the best. There's just one request. We are already delayed by around 45 minutes. So you are requested to stick to the timeline. So try to finish, if possible, in 8 minutes. But of course, the time allotted to you is 10 minutes. So 8 minutes, the buzzer will ring. And 10 minutes sharp, you should close, so that there's some time for discussion also. We have our co-chair in the form of Dr. Limaye. So if you allow some time for discussion, then you have his inputs also coming up, which will be really helpful to you. Yeah. So all the best to you. So here we begin. I think we can call the first presenter, or if Dr. Limaye wants to make some remark.
Anyway, without wasting much time, let me call upon the first speaker straight away. We have Alisha Walson, and she's going to speak on fianthene, a compound isolated from Cyclia pendata.
So, respected dignitaries chairing the session, other research scholars, good afternoon, everyone. And myself, Alisha Walson, and welcome to my presentation, which is entitled as Fianthene, a bisbenzyl isoquinoline alkaloid, which is isolated from Cyclia peltata, it induces a mitochondrial mediated apoptosis in cervical cancer cell line HeLa. The work was done under the supervision of Dr. K.V. Radhakrishnan and Dr. Kaustubh Kumar Maiti at Organic Chemistry Section, CSIR NIST, Trivandrum. Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. According to WHO reports, cancer is the second leading cause of deaths worldwide, accounting for nearly 10 million deaths in 2020 alone. There's a report from American Cancer Society that from 2016 to 2030, the worldwide cancer cases are projected to increase by 24%. That is exactly from a number of 17 million to 21 million. So there's an urgent need to develop more successful therapeutic entities with affordable cost to cure this deadliest disease. So natural product is a better option. Nature has generated an astonishing array of molecules with diverse forms and functions refined by evolution over millions of years. Natural product is any organic compound that is synthesized by a living organism. The identification or the development of a drug from a natural or plant-based origin is a tedious process which involves the isolation, characterization, and the screening of many bioactive molecules. And the identification of a natural product for an in-depth study to develop a natural product-based drug is the need of the hour today. So keeping in this mind, we have selected a plant which is known as Cyclia peltata, belongs to the family Menispaceae. The plant is known as Rajapata in Sanskrit and has been a part of many formulations in Ayurveda, especially for the treating ailments of women reproductive system ailments. So from the available pieces of literature, it is clear that the plant possesses some anti-cancer activity, but it is being studied only at an extract level. So we decided to extract the phytomolecules which is responsible or which is imparting the anti-cancer potential, and successfully we have isolated 3 compounds from the rhizome of the plant, which are fianthine, cyclianine, and N-cordialine. And we carried out the preliminary cytotoxicity screening by MTT assay, and from the table it is clear that the compound fianthine possesses more potent inhibitory activity against cervical cancer cell HeLa with an IC50 value of 8.1 micromolar. Next, we are interested whether the compound is safer to a normal cell line up to a minimum concentration that we can be used in a cervical cancer. So we have selected a cell line MCF10A, which is a non-tumorigenic cell line. And in the cell line, we could see that it is safer up to a higher concentration, and its IC50 comes only up to 36. We are not using to that higher concentration. So we have selected this plant for our downstream in vitro studies. First, we studied whether our compound can inhibit the clonogenic potential of HeLa cells. And from the result, it is very much clear that at a very low concentration, that is 0.5 micromolar and 1 micromolar itself, the compound is able to inhibit the colony formation ability of individual HeLa cancer cell lines, and also it downregulated or reduced the survival fraction at a higher good level. Next, apoptotic studies, we use some microscopic techniques like live dead assay and APOP staining. And from the result, we could see that more number of red to colored cells in the first panel, that is this figure shows the more number of apoptotic cells. And in the APOP staining, we could observe purple stained cells in the treatment group showing the membrane compromised cells due to apoptosis. To confirm the process of apoptosis involved in the process, we have studied the Annexin 5 assay, and from the result, we could observe a more population of cells in the late apoptotic population cells in, upon treatment than the control group. Also, we performed the caspase fluorimetric assay to study the involvement of which caspases, and we studied the expression of the executional caspase 3 and other 2 initiated caspase 9 and caspase 8, and from the data, we could observe a upregulation of caspase 3 and caspase 9, which clearly indicates the involvement of an intrinsic apoptotic pathway. Since mitochondria is involved, we were interested in our compound, whether our compound can induce some depolymerization. First, we studied the mitochondrial depolymerization by JC1 assay, and from the result, we could see the JC1 aggregate to monomer ratio is cutting considerably reduced upon treatment with the group, treatment with the compound. And also we studied the release of cytochrome C from the mitochondria into cytosol. And upon treatment with the compound fiandin, we could observe a release or downregulation of mitochondrial cytochrome C and an upregulation of the cytosolic cytochrome C, which clearly indicates the release of cytochrome C from mitochondria into the cytosol upon treatment with the compound fiandin. And nuclear condensation and fragmentation are two more important parameters of apoptotic DNA. So we studied the condensation pattern mainly by Hess nuclear staining. And in this image, we could see a more brightly fluoresced areas, which indicates the condensed DNA. Also, the fragmentation pattern was observed by a peculiar DNA fragmentation pattern, which laddering pattern, which is a characteristic feature of apoptotic DNA. Also, we studied the internalization and DNA fragmentation by surface enhanced Raman spectroscopy. And we could observe the characteristic peaks of fiandin at these areas, that is 1000 centimeter inverse, 1212 and 1590 nanometer are getting reduced or diminished after an incubation of 4 hours, which may be because of the metabolic degradation inside the cell. And also DNA fragmentation pattern was again confirmed using SIRS modality. Next, we were interested the compound, whether it can induce the cell cycle arrest, and we could observe the downregulation of major key proteins involved in the regulation of cell cycle, like cyclin A2, cyclin B1, CDK2, and CDC25. Also, from the cell cycle assay, we could see a probable arrest at an S phase. Also, we could observe an increased population of cells at sub-G1 phase, indicating the apoptotic population of cells. Next, we were interested in studying the expression of various proteins involved in apoptotic pathways. And we followed this mechanism like apoptotic membrane array, and also we performed the Western blot analysis. And we could observe mainly the upregulation and downregulation of major proteins involved in the pathways. And from the above result, we proposed a mechanism by which the compound fiandin can induce the cell cycle apoptotic cell death. So, firstly, the compound can induce the activation of major pro-apoptotic proteins, and also it downregulate the expression of major inhibitors of apoptotic proteins like XIAP and CIAP, and which in turn activates the caspases involved in the process, and which will activate the apoptotic stimuli and further cell death. And also, the compound can inhibit the survival pathway or the survival and proliferation pathway by inhibiting downregulating the CD40 ligand binding, and also downregulating the expression of IGF-2, which in turn downregulates the AKT-PAKT pathway, and which obviously will downregulate the proliferation. Also, the compound is able to upregulate the P21, P27, P53 characteristic proteins involved in the apoptosis. So this is a mechanism we proposed by which our compound can activate the apoptosis in cervical cancer cell line. And as in conclusion, fiandin inhibitor the proliferation of cervical cancer HeLa with an IC50 value of 8 micromolar. It induced a mitochondria-mediated apoptosis and the release of cytochrome C into cytosol. Downregulated the PAKT survival pathway, which was we can see from the expression plot of PAKT. Internalization of fiandin into the cells monitored by SIRS, and fiandin inhibited the clonogenic potential of HeLa cells at a very low concentration, and so it induced a cell cycle arrest. And this is the first report on the detailed in vitro assessment of apoptosis induced by the compound fiandin. Thank you.
Congratulations, Alisha. We have stuck to time. Very good. So we have maybe a few questions from the audience. Anybody wanting to ask any question? Everything is understood? Just for sake of my understanding, I'll just ask you two quick questions.
Yeah, sure.
So in which solvent did you dissolve your compound when you
Actually,
treated?
sir, we performed in DMSO.
DMSO.
Light concentration, and we diluted it in water, distilled water.
Okay, so so you must be having a control, right?
Yeah.
A control dish in which you must have put vehicle alone, right? No?
No, sir. Actually, we used to control as the untreated cells of the compound.
So, so as much as I understand, you have not used any vehicle control.
Yes.
because your vehicle itself may be doing something to the cells, right?
Yeah, that's why we have minimally reduced the volume of DMSO and we have diluted all the concentration
Exactly.
in
So,
water.
so what is that final concentration of DMSO that you see?
It's 0.1%.
0.1%. Good. Last question. You measured IC50 value, right?
Yes, sir.
How did you measure IC50 value?
Sir, we will perform the cytotoxicity assay in different concentration. Like in my case, I have selected 100 micromolar, 50 micromolar, 25 micromolar, 10 and 50. And we will plot the graph, and where the 50 comes, we will plot it in.
So that inhibition at 50, is
50,
it just by visual inspection, or you use some curve fitting algorithm to find out what is the IC50?
Not algorithm, sir. We calculated using the graph, like at which concentration 50% of cells may get died.
Are there any known inhibitors known for pheonthine?
Inhibitors. No, ma'am. Actually, no such works are reported for pheonthine. This is the first report on its activity.
All right. Thank you.
Okay, thank you.
So we call upon the next speaker, Hitarth Patel from Gujarat Cancer Research Institute, Ahmedabad. And the topic of his presentation would be identification of natural compounds to inhibit sonic hedgehog pathway in oral cancer.
Good afternoon to the dignitaries present on and off the dais and to all my fellow delegates. My name is Hitarth Patel and I am presenting the work on identification of natural compounds to inhibit sonic hedgehog pathway in oral cancer under the guidance of Dr. Frank D. Shah. So coming to oral cancer, the worldwide incidence of oral cancer in Globocon 2020 is 1.95% worldwide, whereas the mortality rate comes to 1.78% of the total cancers. Now coming to India, the western part of India shows more oral cancer cases. So where the incidence for the oral cancer cases in India comes to around 10.26%, whereas the mortality rate comes to 8.84%. Now coming to the institute from where I am working, that is the Primary Cancer Institute in Gujarat, the GCRI, that 34.75% of the total cases in 2021 were identified of oral cancer. So the current prevailing issues in oral cancer that are increased incidence and higher mortality rates. No primary screening test is still available till date. Higher loco-regional recurrence rate. Early detection of oral cancer is still not available. Development of new targeted and not specific targeted therapy has not been found till date. And till time, development of chemoresistance and radioresistance to the current treatment modalities has been observed. So now with the increased incidence and with the increased mortality rate, a change in approach towards the cancer is much required. So this is where cancer stem cells comes into the picture. Now, what is cancer stem cells? We have seen in the earlier lecture in the plenary sessions that it is a part of tumor cells which have been found to resist conventional cancer treatment strategies, that is chemotherapy, radiotherapy, and certain times targeted therapy also. However, the cancer cells, the part of the tumor does diminish, but the cancer does not die. And the cancer cells as a result survive when it ultimately leads to relapse or metastasis of the cancer. So how can you target cancer stem-like cells? So to target cancer stem-like cells, there are many ways to target, but we'll be focusing on specifically pathway-based targeting. So pathway, there is a pathway known as hedgehog pathway. So hedgehog pathway signaling is believed to maintain the stemness properties by expressing the stemness markers such as NOC, OCT4 and SOX2. So hedgehog signaling has been observed in embryonic stem cells as well as pluripotent stem cells too. So hedgehog-driven cancer stem cells have been validated in numerous hematological malignancies. Hence, as a result, as it has not been studied in solid tumor malignancies, it was selected for the oral cancer study. So the rationale of the study till here you could see is that with increasing incidence of oral cancer in India, which leads to that the current treatment modalities are not working effectively, which leads to the relapse of the metastasis. What we could do is we can directly target the cancer-driven stem-like cells, and as a result, targeting them along with the current treatment modalities or along with the natural compound could be beneficial in curbing the cancer incidence rate. So now what is hedgehog pathway? So hedgehog pathway basically gets activated with one of the hedgehog ligands. There are 3 hedgehog ligands, that is sonic hedgehog, Indian hedgehog, and desert hedgehog. It binds to the receptor patch 1. So here it binds to the patch-1 receptor, and as a result, the patch-1 will relieve the suppression of SMO. The SMO will enter to the primary cilium, and it will, as a result, activate the downstream signaling, thus activating the GLI channel. The GLI will go to the activator form, and as a result, the transcription of the downstream activated transcription genes will be activated. So now what we could do here is we could directly target the sonic hedgehog ligand. So sonic hedgehog ligand is the widely reported ligand available in the hedgehog pathway. As a result, what we could do is we could directly target the sonic hedgehog ligand, inhibit it from binding to the patch-1, and as a result, the hedgehog pathway will get subdued. So now why natural compound? As previously discussed, there are many side effects of chemotherapy and radiotherapy, and as a result, resistance has also been observed. So for that reason, natural compounds can be used for, has been used in medicinal purposes since ancient times for many of the chronic diseases as discussed in Indian literature. And the advantages of using natural compounds are available at low cost, and there are no such side effects reported. So the aim of our study was to identify natural compounds as the potential anti-cancer agents, which could work individually as well as in synergy with the known hedgehog ligand inhibitors for the treatment of oral cancer. Now we had selected 14 of the natural compounds. So 10 of them was done from NPEC database, where we had identified regarding specifically the term was utilized as oral cancer, and the 4 of the natural compounds was utilized from literature reviews. These are the PubChem IDs that were utilized for the study. For the protein molecules, 2 molecules were considered. One is human sonic hedgehog N-terminal domain. Why N-terminal domain? Because it is where the signaling takes place properly. So for that reason, a native protein, complete native protein was considered, and sonic hedgehog bound to the 5-1 Fab fragment. So 5-1 is a known chemical inhibitor that has been known to inhibit sonic hedgehog. So that's why these 2 proteins were considered. UCF Chimera software was used to prepare the protein and ligands. Umber force wheel was used to assign charges to standard residues as well. Unknown residues were assigned charges through EM1 BBC method. Ligand binding site prediction was done through FT site server, whereas the docking studies were confirmed by orthodox studies. So ligand binding site prediction, the FT site server predicted 3 binding sites for 3 M1 protein. Among the 3 binding sites, 2 binding sites showed the results that we had found from the docking studies. These are the 2 binding sites. The bold residues that you're seeing over here indicates the presence in the docking results. 3-MXW protein is basically a protein prepared by a batch group of scientists with a different sonic protein and with a known inhibitor. So for that reason, the FT site was not able to gather us the ligand binding sites. So the docking results were 3 M1N proteins, so the native protein. We docked 13 13 natural compounds, among which we got 3 best results in butene, biotenine A, and curcumin. So the application also gave us the inhibition constant from that, and these are the results that were observed. The docking results were observed. Similar way to 3-MXW protein, Zerembone, curcumin, and butene was observed. However, Zerembone did not show any hydrogen bond formation, hence it was not studied further. But however, with curcumin and butene showed a very good result. The amino acid interaction of the dock structure, these are the where the amino acids were interacted with both of the proteins. So why we studied amino acid was the identification of amino acids within the protein structure and the selected ligand could help in understanding the possibility of substituting amino acids. So directly where we could inhibit or we could render an inactive state of the protein. So coming to the discussion with growing side effects of the current treatment modalities of oral cancer, newer perspective was required. So that is where, as discussed, cancer stem cell came into the picture. Hence, targeting the hedgehog pathway with bioactive compounds could be a significant to the current treatment line of cancer. The study showed that curcumin and butene had better interaction with both of the proteins compared to the other natural compounds. Now, what is curcumin? A polyphenol found in rhizomes of Thermoic curcumin longa has shown roles in targeting sonic hedgehog pathway in lung cancer, breast cancer, and bladder cancer. So, as I said, it has already shown its anti-cancer properties. So, it could show a good positive result in oral cancer too. So, butene, a polyphenol extracted from heartwood of Dalbergia derifloria, has not yet been widely explored in oral cancer. There have been many few reports submitted, and it has been shown to inhibit the invasiveness and migration potential of oral cancer stem cells. which has been just published in 2019. Hence, utilizing butene as a potential anti-cancer agent could be a master stroke. Biocanine A is isoflavone. It has been found in red clover, cabbage, and alfalfa. And populations have shown that having higher isoflavone index can lead to lower rates of cancer. So similar to butene, biocanine A is yet to be explored in oral cancer. So again, this could be provide us a valuable insights. The novelty of our study was that we performed in two of the proteins, sonic hedgehog, one in the native state and one in its with its known inhibitor PI-E1. This study was therefore helpful in studying the role of natural compounds as an individual anti-cancer agent or as a facilitator in silencing the hedgehog pathway with the combination of PI-E1 and natural compounds. Conclusion: with the help of safe natural compounds, we believe that we could move towards the utilization of natural compounds as a chemoprevention by targeting hedgehog signaling path in oral cancer. And incorporation of the bioactive natural compound in synergy with the current treatment model, this may lead to a better treatment outcome with reduced side effects. Thank you. No, ma'am. We did perform individually. We didn't perform simultaneously because the reason was as we were using a known inhibitor 5-1. So for that reason, we had studied it individually. So we wanted to see the individual effects of the natural compound along on the native protein as well as on, with the known inhibitor of the protein. So that was the main reason why we had performed it individually.
So as I understand, your purpose is to look for a compound which is going to suppress sonic hedgehog.
Yes, sir.
Because activated sonic hedgehog pathway is going to promote tumorigenesis.
Yes, sir.
That's
yes,
what
sir.
the idea is.
Yes, sir.
So did you have any chance to put these compounds on cell culture models at least and then see how?
So we have started the process. We have started trying to grow it on primary cell culture. So the process has been started.
But would you require cancer stem cells for these experiments? Because the whole focus was cancer stem cells, right?
So yeah, basically the hedgehog pathway is a cancer stem cell, known stem cell pathway. So for that reason, a change in approach was already being focused in since the last few years. So that's why cancer stem cell came into the picture, because hedgehog pathway has already been focused in embryonic stem cells. So as it is a stem cell pathway, so how we target the natural compounds along with the stem cell pathway could be the final answer to our curbing the incidence of oral cancer. So that is how the rationale of our study was decided, sir.
Audience?
The first question is, why do you think the incidence of oral cancer is more in western parts of India?
So basically, why I do believe is, as I also come from the western part of India, what we could see is that people are using more tobacco products. People are more using areca nut, bitter nut cigarettes. Alcoholism has been increased. So that has been, I consider, as a major reason why the incidence of oral cancer has been increasing. And other than that, all of the other popular HPV induced, all we know the reason. But the major reasons why I consider in Western region is due to the use of more tobacco related products.
Second question is, do you think that there would be any adverse effect if we inhibit sonic hedgehog pathway?
Sorry, I couldn't get your question.
Do you think there will be any adverse effect if we inhibit sonic hedgehog pathway?
Adverse or advanced?
Adverse effect.
Adverse effect. Related to patients or related to the cell culture study?
Related to patients.
Related to patients, the thing is there have been many reported clinical trials going on, not with the sonic hedgehog ligand inhibitors, but with SMO, a pathway component, smoothen receptor. So vismodegib and sonidegib is the known inhibitor of the pathway. There have been few adverse effects observed along with that clinical trial, but not yet with the sonic hedgehog ligand inhibitors. So yes, I don't think so there would be a side effect, but yes, if there is a side effect, so that's why natural products can come into the conclusion. So for that reason, natural products can be the answer to our solutions. See, the thing is, downstream activation, so hedgehog pathway activates by two, canonical and non-canonical way. So if you are doing by canonical activation, there might be an effect on non-canonical activation too. So if you are studying it in a canonical way, I don't think that there will be such adverse effect. But yes, if you're looking for a non-canonical way, there might be a change in the other pathways that are associated with Hedgehog pathway. So there might be a change in, I guess, we are still studying certain roles through bioinformatics analysis. So I guess PI3K, APT pathway, Wnt pathway, that has showed certain roles along with the Hedgehog pathway. So that might alter.
Okay, thank you, Hitarth, for a very good presentation. I think I will call upon the next speaker quickly. You are Neha? Yes. She's going to speak on calcimycin induces cell death in breast cancer and cervical cancer cell lines.
Good afternoon, sir, ma'am. Good afternoon, everyone. I, Neha, going to start my presentation entitled Calcimycin induces P2RX4 mediated cell death in breast and cervical cancer cell line via intracellular calcium and P38 MAPK pathway. So first start with the introduction. As we all know that the cancer is the well-known second leading cause of death globally, whose incident and mortality rate is rapidly growing each year. As per the WHO report, up to 2040, 47% to more cancer cases would be rises. Our objective in his work to explore the mechanism of action of the anti-cancer activity of the compound calcimycin using cell line method. Calcimycin is a inophobic compound whose antibacterial and antifungal activity is well known. It also induces the intracellular calcium level. For the initial study, we have selected two cancerous cell line. One is MCF7 of breast cancer and second is the SHIHA for cervical cancer. And the first cytotoxic evaluation was done by MTT-assay, which gives the result of IC50 value 0.30 micromolar for MCF7 and 0.35 micromolar for SHIHA. Further, wound healing assay has been done to check the effect of this compound over the migration rate of the cell. We can see from the image in the control section, the scratch gap has been refilled after 24 and 48 hours, while the treated condition at IC50 value, the scratch gap is still persisted, showing the migration rate of the cancerous cell could affected by the compound treatment. Next, acridine orange ETBR staining has been done at 3 concentration. First is IC50 and second is the -10 IC50 and +10 IC50. And we found that by increasing the concentration of compound, the late apoptic or early apoptic cell number is increases with respect to increasing concentration. DAPI staining is showing the high number of nuclear fragmentation and chromatin condensation is found with respect to the increased concentration of compound in both cell line. Cell cycle analysis results give the large number of cell accumulation at G2M phase. That means cells could be arrested at this phase. Apoptosis assay giving the result by increasing the concentration of compound in both cell line, the number of late apoptic cell is increased. So by observing this result, we can conclude that the compound calcimycin could induce apoptotic cell death in both cancerous cell line. Next part of the study is to explore the mode of action of this compound. Calcimycin is a well-known calcium inophobe. So first we cross-check the intracellular calcium level with respect to the compound and found that with the increasing concentration of compound, the peak is shifted toward the right. That means high fluorescence. So it corresponds to high intracellular calcium level. Next, we chelate this intracellular calcium by using intracellular calcium chelator BAPTA-AM and found that the intracellular calcium level gets suppressed. So next, we check the link of this intracellular calcium elevation with apoptosis. So we done DAPI staining and apoptotic assay and found that in the double positive section, we can say the number of late apoptic or chromatin condensation is get decreased in the single positive. Single positive is only calcimycin treatment, while the double positive is the BAPTA-AM treatment 3 hours prior to the calcimycin treatment. So we can concluding that the calcimycin treatment enhance the intracellular calcium, which could be responsible for apoptotic cell death, because when we chelate this intracellular calcium, the apoptotic activity is also get suppressed. Next, we checked the effect of the compound over mitochondrial membrane potential and found that with the increasing concentration of compound, the peak is shifted toward the left side by in the case of TMRM dye. So that means the mitochondrial membrane permeability gets suppressed. And we concluded that the intracellular calcium enhancement could directly affect the mitochondrial membrane potential because it is the known or published data that the calcium, when interact with the mitochondrial matrix enzyme, it affects the mitochondrial permeability transition for this MPTPT and affect the mitochondrial membrane potential and enhance the mitochondrial membrane pore. As we know that the calcium and ATP is well interlinked pathway, so we interested to check the effect on the ATP level, and we found that with increasing concentration of compound in both cell line, the extracellular ATP level get enhanced. Further, we checked the mRNA expression of P2RX4. P2RX4 is an ATP mediated ion channel, belongs to the family of purinoreceptor. So next we antagonist this P2RX4 by specific antagonist 5-BDBD and found that when we antagonist this P2RX4, the intracellular calcium level also gets suppressed. So next we try to link this antagonist or the activity of this P2RX4 with apoptosis and found that in the double positive condition, that means where in P2RX4 is get antagonist in DAPI, acridine orange and flow cytometry, all three results confirm that by antagonizing P2RX4, the apoptotic event gets suppressed as compared to the only calcimycin treatment at IC50 value. So we are concluding that the calcimycin enhancement result in enhancement of intracellular calcium responsible for apoptotic cell death could also be mediated by P2RX4 because when we antagonize this P2RX4, the calcium level gets suppressed, apoptotic event gets suppressed. Extra, we also did the docking of calcimycin with P2RX4 and found that the calcimycin directly interact with P2RX4 at the active site. And so we can assume that this is our novel finding. We are the first time reported the direct interaction of P2RX4 in case of calcimycin in cancerous cells. So we can, well, it's this further validation right now, but we can conclude that with this P2RX4 activity or we can efficiency could enhance in the case of calcimycin treatment. Next, we checked the effect of P38-MAPK pathway, and we found that in the calcimycin treatment conditions, the phosphorylated P38 as well as cleaved caspase get more expressed in both cell line, and these both get suppressed when we chelate the intracellular calcium, antagonize the P2RX4 as well as the P38 specific inhibitor. While no effect has been found in the P38 level. Next, we check the inhibition of this phosphorylate P38 in apoptosis by using a specific inhibitor. And again, by the 3 assay, we found that the late apoptic cell number as well as chromatin condensation gets suppressed in the double positive. That means when phosphorylated P38 is suppressed as compared to the only calcimycin treatment. So we assume that the enhancement of intracellular calcium could affect the overexpression of phosphorylate P38, which further also overexpression of the cleaved caspase 3 and apoptosis. And when suppressed with phosphorylated P38 by specific inhibitor, the cleaved caspase 3 overexpression is also get suppressed. So by analyzing all these parts of the experiments, we have reached on the conclusion that the calcimycin induces the apoptotic mode of cell death in both cancerous cell line by different methods. First, it enhanced the intracellular calcium, which could directly affect the mitochondrial membrane potential. Second, via following MAP kinase pathway, it could affect the phosphorylation of P38, and this phosphorylated P38 target its BCL2 that membrane potential affected by result. Next finding is the calcimycin inducing apoptosis by calcium level could also be affected by P2RX4 activity. So these are the conclusion of this study, that the calcimycin food induces the apoptotic mode of cell death line via P2RX4 mediated ATP dependent P38 and intracellular calcium level mediated apoptotic cell death. Thank you.
Thank you, Neva. You have actually absolutely stuck to time. So I have a couple of questions. Right. So you are trying to say that, okay, calcimycin can be used against cancer cells?
Yes, sir.
And you say that this is an ionophore.
Yes, sir.
So what makes you believe that it is not also going to kill normal cells?
Sir, we had checked the MTTSA over the HEK293 cell lines. Concentration is vary. For example, when we Shiha and MCF7, we found 0.3 or 0.35 molar is represent the IC50. But in the case of HEK293 cell, we found that at 0.8 micromole up to 1 micromole, it is causing only 23 to 25% cell death. So yes, and the pathway is also basic pathway. So obviously this compound could affect the normal cell line, but due to this concentration difference, it could mostly target the cancer cell line as compared to the control.
So last question. So you said calcimycin will also induce P2RX4, right? The mRNA is increased, right?
mRNA is increases.
So can you say a little more about how is this mRNA increasing in the presence of calcimycin? What is the mechanism of this induction of this mRNA?
No, sir, we didn't check that. We checked the mRNA expression elevation and the direct binding, which could affect its efficiency or activity. So these are the parts which we need further validations.
Is this P2RX4 differentially expressed in normal cells and cancer cells?
No, sir, this is normal.
No, I mean, is there a difference in the expression?
No, sir.
Present equally well
Yes,
in both
sir. Yes,
normal
sir.
as well as.
Yes, sir.
Open it for the audience. Any questions? All right, thank you so much.
Thank you, ma'am.
So we can move on to the next speaker now. And I invite Yogin Chand from Punjab University, Chandigarh. And Yogin is going to talk on evaluation of ergosterol and its metabolites for their anti-cancer potential.
Respected chairpersons, my supervisor and my fellow researchers, a very good afternoon to you. The title of my research is Analysis and Evaluation of Ergosterol and its Metabolites as Agonists of LXR, liver receptors and their anti-cancer potential in colorectal cancer. First, a brief introduction. Colorectal cancer, as we know, is most common cancer worldwide and the second leading cause of cancer-related morbidity and mortality in the cancer patients. It is a malignant neoplasm arising from the lining of colon and rectum. Coming to the relationship between cholesterol homeostasis and CRC, as we know, cholesterol accumulation has been widely recognized as a hallmark of cancer, which leads to activation of various oncogenic pathways such as and enhanced cell proliferation, metastasis, and other factors that lead to cancer. In our lab, previously we conducted a study which established that the role of HMG co-reductase in regulation of cholesterol homeostasis is not as pronounced as that of liver receptors. Therefore, we have focused our study on the regulation and expression of liver receptors. Liver receptors exist in two isoforms. First one is alpha, which is mainly present in kidney, liver, and intestine. The second one is LXR beta, which is a ubiquitous receptor. LXR act as cholesterol sensors. LXR act as cholesterol sensors and mainly regulate cholesterol homeostasis of cholesterol efflux by activating the expression of FK1 and ABCG1, which are both cholesterol efflux transporters. Other than its role as cholesterol sensor, LXRs bind to LXR response elements on the DNA with RXR and made a heterodimer, and then inhibit the expression of various genes that progress the development of cancer, such as c-MYC, cyclin D1, beta-catenin. As the title indicated, that we have used phytosterols to increase the activation and expression of LXRs. Phytosterols, also known as plant sterols, resembles cholesterol in structure and function. Plant foods such as vegetables, seeds, grains, vegetable oils are a source of phytosterols. We did a brief literature study, and it was noted that the 3-beta hydroxyl group of testosterone are essential for a ligand to activate LXRs, while the presence of 3-alpha hydroxyl group renders them inactive. These are the structures of the compound phytosterols that we have used in the study. The objectives of the study includes analysis of the structure function relationship of LXRs with ergosterol and its metabolites, which includes a detailed analysis of LXR binding potential of ergosterol and its metabolites using in silico approach, which includes molecular docking based approaches followed by molecular dynamic simulations of 10 nanoseconds. The second objective of the study is determination of anti-tumor potential of selected LXR agonist in vitro colon cancer cell lines by using MDT assay. Coming to a result, the molecular docking studies gave us a very good affinity of the selected phytosterols against both the isoform of LXR, which are alpha and beta. As you can see in this table, the binding affinities were higher than -10. We compared the ligand. Next, we compared the ligand binding sites of LXRs for a non-agonist against the selected phytosterols, and it was observed that both the non-agonists such as GW3965 for LXR alpha and the selected phytosterols bind at the same site within the receptor binding site. Same is the case with the LXR beta. That means the artificial agonist for LXR beta and the selected phytosterol bind at the same binding pocket within the LXR beta receptor. Thereafter, we conducted a brief intermolecular interaction studies between the LXR alpha residues and the lichen molecule. And it was observed that ERG, ERG2, and ERG3 possesses the activating interactions which were critical for ligand to activate LXRs. These critical interactions involve arginine 305, which are highlighted in magenta color, and leucine 316, which is also highlighted in magenta color. Similar observations were reported in case of LXR beta, that is presence of critical binding, critical activating interactions in case of ERG, ERG1, and ERG3. These critical activating interactions residues include leucine 453, tryptophan 457, and histidine 435, which are also represented in magenta color. Next, to assess the stability of the docking complexes we have obtained, we did a 10 nanosecond molecular dynamics simulation studies, which include root mean square deviation studies, root mean square fluctuation calculations, and stability of hydrogen bonds. First, root mean square deviation. ERG, ERG2, and ERG3 displayed an average RMSD, root mean square deviation of around 0.25, 0.16, and 0.1 nanometers for LXR alpha. As the graph shows, the green is of ERG3. ERG3 form the most stable complex with the LXR alpha complex. The second one is root mean square fluctuation. While root mean square deviation represents the global deviation in the structure of a complex, root mean square fluctuation represents local changes in atomic position within a structure. This circle highlights the residues which are critical for activating the LXR alpha receptors. As we can see, these residues were not flexible as were the loop regions. These were the loop regions. Now, the stability of hydrogen bonds were assessed. As we have seen in the 2D interaction plots I have conveyed before, there were formation of a single hydrogen bond that was stable enough to activate LXRs. Similar results were obtained while assessing the stability of hydrogen bonds through molecular dynamic simulation studies. Similarly, in case of LXR beta, ERG, ERG1, and ERG3 displayed an average RMSD of around 0.13, 0.12, and 0.15 nanometers respectively, indicating the formation of stable complex with LXR beta. Next, we calculated the root mean square fluctuation. Similarly, here these circles represent the residues of the active sites, and they were not as flexible as those of loop residues. Now, the stability of hydrogen bonds was assessed as the 2D interaction plot indicated that there were no stable hydrogen bond in case of LXR beta, and only the hydrophobic interactions were present. Thereafter, to assess the anti-cancer activity of the selected compounds, we did in vitro cytotoxicity assays using MDT. And we performed these cytotoxic assays on 2 cell lines. The first one is SCT116, which is a colon cancer cell line. As the graph indicates, we have obtained a significant toxicity against the colon cancer cells by all the selected phytosterols at a concentration of 1 nanomolar and above. And in the case of ERG3, the effective concentration was beyond 10 picomolar. We also conducted the cytotoxicity evaluation of vehicle control. As you can see in all of these diagrams, vehicle control displayed an average cytotoxicity of around 5 to 6%. In CHK1 cell line, which is a normal epithelial cell line, the cytotoxicity assay was carried with the same selected phytosterols, and there was the cytotoxicity effects of these sterols on normal epithelial cells were not as pronounced as that of colon cancer cells. Now, coming to the conclusion of the study, both the molecular docking and dynamic studies revealed that ARG3 formed the most stable complex with both the receptors, and it is also associated with a significant toxicity, that means for SCT116 cells at a concentration of 1 nanomolar and above. And there was no significant toxicity observed in case of normal epithelial cell lines, suggesting that a tumor-specific effect of selected metabolites. Thank you. Basically, ma'am, this ergosterol and its metabolites are present in yeast. This is the yeast metabolism. But since the fungus also comes in plant kingdoms, we have notified them as plant sterols. I know it. Liver.
One question.
Yes. Sir, we did the validation of the docking studies. So validating the binding of a non-agonist, which was already present in the PDB structure. We first docked that molecule, that agonist, with the receptor, and we found that the site where we conducted an alignment study, and the alignment root means
So these are all sterols, right?
Yes.
So did you take any completely random compound, organic compound, which has no connection with any steroid structure?
Yes.
So did you try
yes, sir,
with that?
We tried flavonoids, terpenes, and the binding affinity, those we observed with those classes of molecules were very less than with that of
so it's better to incorporate that also. Okay. Then you any questions from the audience? Okay. If there are no questions, thank you for your presentation. Let me call upon the next speaker. It's Madhukrishnan M. So he's going to speak about elucidating search-guided metabolic glycan labeling.
Good evening, all. I'm Madhukrishnan M, student of Dr. Kaustubh Kumar Maiti from CSIR NIST Trivandrum, and I would like to present my work, which is titled as Elucidating Search-Guided Metabolic Glycan Labeling, an Appraisal of Metastatic Potential in Cancer Cells. Now, before coming to work, as we all know, the day before yesterday, the Nobel Prize for Chemistry was announced, and one of the recipients was Dr. Caroline Ann Bertozzi, who was a pioneer in the area of development of bioorthogonal reactions, the area in which I am also working. So it is such an inspiration for me also. She was the first one to actually show us that using the N-acetyl mannosomine with a bioorthogonal keto group, that we can actually label the glycans by transforming into sialic acids. So bioorthogonal means it does not react with any other biological process in a living organism. So glycans are, as we all know, present at the at the terminal of the cell surface. There is a 9-membered carbon atom, which is known as sialic acid. So what she did was she used this N-acetyl mannosomine, and through its biosynthetic pathway, it transformed into the sialic acid. So such strategy is known as metabolic labeling. Means utilizing cells on biosynthetic pathway to create or label detectable marker metabolites or molecules. And she also utilized copper assisted alkyne acyclic chemistry as well as Schrodinger application in her labeling of different metabolites. Coming to the other parts, the glycan profiling has been done by different methodologies like multi-imaging, Raman scattering imaging, and microscopic imaging. And there are several literatures reported for labeling the glycans, nucleic acids, lipids, etc. Here we are utilizing the SERS technique, which is surface enhanced Raman scattering technique, in which we will be using metal nanoparticle like gold nanoparticle or silver nanoparticle. And in presence of this metal nanoparticle, there will be much hotspot generation will be there, so that the analyte in which is near to this metal nanoparticle will have maximized signal intensity of the order of 10⁴ to 10⁵. Coming to our approach, so we have utilized a strategy called MGL SERS strategy, which is metabolic glycan labeling through SERS. So for that, we have taken the nutraceutical, which is glucosamine, and we synthetically converted into a metabolic labeling agent, GLC and PHALK. So this is the first report of N-alkyl derivative used for the glycan labeling imaging. All the reported one was N-acetyl one. So we have utilized an N-alkyl derivative, which means that only the NH group is needed for the enzymatic recognition to transform it into biosynthetically to sialic acid. There are other advantages. Since it is an unacetylated molecule, we can avoid the artificial S-glycosylation, which is already reported in Acuvante. Also, phenyl conjugated alkynes is used, so we will get much better signal intensity. So the strategy is that we will incubate our molecule 100 micromolar of GLC and PHALK within the cells, so that the cell will take up the glucosamine with the tag alkyne molecule, thinking that it is a carbohydrate, so it should take it out. So through biosynthetic pathway, it transforms into sialic acid. And on top of that, there will be the tag, which is the alkyne. Then we will remove the medium and we will wash with PBS 3 times. Then we will add the gold nanoparticle. So in presence of this gold nanoparticle, we will get the much good Raman intensity as well as Raman image. So through this Raman image, we were able to discriminate between the cancer cells with varying metastatic potential, as well as we were able to discriminate between cancer cell and normal cells. So this is the synthesis and characterization of the metabolic glycan labeling agents that we have synthesized, and we have characterized this through proton, C13 as well as HRMS. So first, we wanted to know which of these metabolically labeled agents are having much SERS, better SERS signals. So for that, we have selected a group of phenyl conjugated molecules as well as unconjugated alkyne molecules, and we have incubated it with a standard called cyanobenzaldehyde. So this cyano group as well as the alkyne group will have the Raman signal at a cell silent region, which means that cells will not have any signals in that region. So it will not be interfere with the cell signals, like from the proteins or lipids. They will have the amide bond. Certain peaks will not be have in 1700 to 2700 region. So we selected alkyne, which is having a peak at 2000 centimeter inverse. So we found that the phenyl conjugated alkyne had the better SERS signal intensity rather than unconjugated alkynes. So in the metabolic glycan labeling agents that we synthesized, the GLC and PHALK had the much better signal intensity, which has the peaks at 1596 centimeter inverse as well as 1991 centimeter inverse. So this 1991 centimeter inverse corresponds to the alkyne moiety, which is having a cell silent peak. And coming to the Raman imaging, so this is the bright field, Raman field, as well as the Raman images of MDMB 231 cell line. So as we can see, the GLC and PHALK has the much better Raman image, which is labeling at the surface itself when we see the bright field as well as the Raman field getting overlaid, rather than its TMS derivative. Since it is much bulkier group, their labeling capability is reduced. So GLC and PHALK is labeling at the cell surface that we confirm through the Raman. Then we confirmed it through the fluorescent imaging technique, utilizing the bioorthogonal reaction of copper-assisted alkyd azide click reaction. What we did was we incubated our GLC and PHALK tag, just like as I said earlier, 72 hours with the cells. Then we treat it with the acetone-naphthalene fluorophore in presence of copper sulfate and sodium ascorbate. So it will have a acid alkyne cycloaddition reaction, and that will turn on the fluorescence. So from the image itself, you can see that it is labeling at the surface only. So we confirm that our molecule is labeling the glycans itself, and it is in the cell surface labeling that we have done. So since we are labeling the glycans, then there must be protein glycosylation that will happen. So this protein glycosylation alkyne generation was confirmed through chemiluminescent Western blot analysis. So what we did was, again, we metabolically labeled our cells. We took the cell lysate. That cell lysate, we did chemiluminescent Western blot analysis using acide PEG biotin as well as HRP streptavidin. So the results shown that whenever our molecule is labeled with GLC and PHALK, we were able to obtain the bands which corresponds to the alkyne generation of the proteins which are glycosylated. And we have taken glucosamine as the negative control. So since it is not, when we incubate the glucosamine, it will not label the glycan proteins. So we will not get any bands from the Western blot analysis. And the same thing we did with the cells analysis of different cell lysates also. So we have taken different types of cells like triple negative breast cancer cell like MDMP231 and cervical cancer cell line HeLa, lung cancer cell line A549, and another low metastatic MCF cell line, and a normal epithelial cell MCF10. So what we already know is that the cancer cell will have much more expression of glycans in terms of the normal cells. What we did as an application is the role of glycosylation in cancer metastasis. So we selected these 5 types of cancer cells as well as a normal cell, and we found that highly metastatic MDMP231 had much better glycan labeling, which means much better glycosylation. As the metastatic potential is getting increased, glycosylation will also increase. Then the lower metastatic MCF7 will be having the least when it converts with the cancer cell, and the normal cell will have the least metabolic labeling, since the glycosylation is the least in the least metastatic case. So we were able to like semi-quantify this glycosylation pattern with respect to metastatic potential. And we analyzed this metastatic potential in different cancer cell using scrape wound assay. Then C-allele transferase inhibitor were used in order to understand this biosynthetic pathway mechanism. C-allele transferase is an enzyme which activates the CMP sialic acid to glycosylate towards the protein in Golgi apparatus. So if we use this inhibitor, and if the glycosylation getting inhibited, which means that it is going through the same sialic acid biosynthetic pathway. And to our expectation, we got the same result. Means when we co-incubate our inhibitor with a different inhibitor concentration, as inhibitor concentration increased, as the inhibitor concentration increased, our glycosylation also getting decreased with the image. So we have utilized the MGL-SERS strategy to label and image the glycans, and then we confirm this labeling through fluorescence imaging as well as Western blot analysis is confirmed its protein glycosylation. Then we have applied it on to understand the role of glycosylation in cancer metastasis, and to understand the mechanism of this biosynthetic pathway, we have done the inhibition study. And in future prospect, we have to see whether it is labeling the N glycans or the O glycans, and we have to see the comparison with the reported manosamine analogs also. So thank you.
Thank you, Madhukrishnan. I just have one small question.
Yes, sir.
So why do metastatic cells have so much of glycosylation?
From the reports, it is seen that in highly metastatic cancer cell, MG85 enzyme is highly expressed, which is a glycosyl transferase enzyme. So once that is highly expressed, the glycosylation will happen more.
Yeah, so but this more glycosylation,
Yes.
how does it benefit in terms of metastasis or proliferation?
Basically, the glycans are have the function of cell-cell interaction. So that in turn will benefit the cell proliferation, I guess.
How do you quantify Raman images?
Raman image, we will take an area So we will keep it as fixed one, like the amount of gold nanoparticle that we add, the amount of our tag that we add, that we will keep it fixed, so that in each cancer cells, whatever that we are getting will be, we can say it is a semi-quantification method. We cannot claim it as it is completely quantification is possible. If the parameters are fixed, like laser intensity, laser power, the concentration of the tags, and the concentration of our cells also, means when we culture cells, if we maintain the cell concentration fixed, then we can say we can semi-quantificate.
We can open it for the audience. One quick question. Okay, there's no question. Okay, thank you so much. So I invite the next speaker, Pratika Rajan from Women's Christian College, Chennai. And Pratika will be talking on antimicrobial activity of green synthesized copper nanoparticles using aqueous extract of Ocimum sanctum.
Good afternoon, sir. Good afternoon, ma'am. Good afternoon. I'm Pratika Rajan, a PhD research scholar from the PG and Research Department of Biotechnology, Women's Christian College, Chennai. I will be presenting a part of my PhD work titled Antimicrobial Activity of Copper Nanoparticles Synthesized from Ocimum sanctum Against Upper Respiratory Tract Infection-Causing Organisms. So, introduction. Traditional Indian systems of medicine, such as Ayurveda and Siddha, explain in detail about herbal mixtures that are used to treat several diseases. Plants produce and store a wide variety of secondary metabolites. The isolation, identification, and determination of these bioactive compounds play a vital role in formulating drugs. Natural compounds possess chemical diversity and less toxicity, thus making them favorable needs in formulating novel drugs. The synergistic effect of several plant extracts can be used to treat diseases. Coming to my work, Ocimum sanctum was taken, the leaves were taken, they were shade dried and powdered. It was extracted using a Soxhlet apparatus for a time period of 5 hours in an aqueous medium. Phytochemical tests were done using standard protocols. Both quantitative and qualitative tests were done. The qualitative results indicated the presence of all the major phytochemicals except for saponins. On doing the quantitative tests, it was observed that even saponins were present in trace amounts of 0.036 milligrams per grams. Alkaloids were found to be present in the maximum amount, followed by tannins, flavonoids, and phenols. To synthesize copper nanoparticles, we took 70% of the aqueous plant extract and added that to 30% of 0.1 molar copper sulfate pentahydrate. A dark brown precipitate was observed, indicating the completion of the reaction. It was centrifuged at 5,000 revolutions per minute for 20 minutes. And the pellet was dried and stored for future analysis. The reaction typically happening here is that copper sulfate in a solution dissociates into Cu2 plus and SO4 minus. The Cu2 plus is unstable and it gets reduced to zero valent copper, which gets further reduced into the nanometer range by the plant metabolites in the extract. In addition, we also did phytochemical tests of the copper nanoparticles, and we found that after this reaction, tannins, flavonoids, quinones, and phenols were present. For characterization, UV visible spectroscopy was done at first. The absorption spectrum was read from 200 to 800 nanometers, and there was a characteristic peak that was seen at 320 nanometers. For FTIR analysis, the absorption spectrum was 400 to 500 centimeter inverse. There were 10 major peaks that were seen, and these peaks give us an idea on the various biomolecules that are present that play a vital role in reducing and stabilizing the nanoparticles. For SEM analysis, the average particle size of the nanoparticles were observed to be 15 to 30 nanometers. The particles demonstrated homogeneity and they were mostly spherical. EDX spectrum was done. This gave us an idea on the elemental composition of the nanoparticles. The most intense peaks belong to that of copper, carbon, and oxygen. There were some weak signals of potassium, sulfur, and phosphorus. which could be due to the X-ray emissions of the biomolecules present in the plant extracts. Zeta potential analysis was done. So zeta potential is the charge which develops at the interface between the solid surface and the liquid medium. This is extremely important to find out the stability of the nanoparticles, especially when it comes to formulating drugs. These nanoparticles had a slight negative charge and it was at minus 5.7 millivolts. Antimicrobial activity was done. For this, 6 upper respiratory tract infection causing organisms were taken. They were Klebsiella pneumoniae, Haemophilus influenzae, Bordetella bronchoseptica, Streptococcus pneumoniae, Aspergillus niger, and Aspergillus fumigatus. The pure cultures were all procured from MTCC Chandigarh. So this was done by agar well diffusion method on MHA plates. Wells were born and then the cultures were swabbed onto the plates. 4 volumes of the sample were added, 50, 100, 120, and 150 microliters of copper nanoparticles were added in each of the wells. There were 2 controls that were used. Tetracycline 30 mcg was used as the control for against the bacterial cultures, and amphotericin B 50 mcg was used as the control against the fungal cultures. The plates were incubated for 24 hours and checked for zones of inhibition. It was observed that the copper nanoparticles showed very good zones of inhibition against Klebsiella pneumoniae, even at a low volume of 50 microliters. There were zones seen up to 37 millimeter for 120 and 150 microliters, as against the control that showed only 10 millimeters. For Haemophilus influenzae, Aspergillus niger, and Aspergillus fumigatus, good zones of inhibition were seen ranging from 10 to 12 millimeters, as against the control, which was almost at par with the control. The copper nanoparticles did not show any zone of inhibition against Bordetella bronchoseptica and Streptococcus pneumoniae. Coming to antimycobacterial activity, for this, the Mycobacterium tuberculosis strain H37RV was taken. It was done by broth microdilution method in a 7H9 enriched medium, and the MIC was checked. So the Mycobacterium tuberculosis strain, there were 2 positive controls that were taken. It was diluted in 1:10 and 1:100 ratios. And rifampicin, which is a standard anti-tuberculosis drug, was used as one of the controls. We also used 0.1 molar copper sulfate pentahydrate. There were 4 assigned drug concentrations that were taken: 125, 250, 500, and 1000 μg per ml. So 0.1 ml of the culture suspension was added to each of the wells. It was sealed and incubated for 2 weeks and checked for the presence of cords, because Mycobacterium tuberculosis typically aggregates into these small structures which resemble that of a cord. Coming to the results, as expected, we saw positive growth of the organism at 1:10 and 1:100 dilution. Rifampicin was able to inhibit the growth of the organism. Copper sulfate was not able to inhibit the growth, and there was positive growth that was seen, but copper nanoparticles were able to inhibit the growth at 1000 μg per ml concentration. So the MIC of the nanoparticles synthesized from tulsi extract was considered to be 1000 μg per ml. This was done at ICMR NIRT in Chennai. Cytotoxicity was done to evaluate the toxic effect of the sample against cell lines. So Vero cell lines were taken, and 100 microliter of the Vero cells were seeded into a 96 well plate. Different concentrations of the sample were taken. It was done by MTT assay, and the absorbance was read at 570 nanometers, and the percentage viability was calculated. Coming to the results, it was seen that at very low concentration, 99% of the cells were viable, but at a concentration as high as 1000 μg per ml, also 62.13 cells were viable, showing that the sample is not very toxic. The IC50 value was calculated using standard software AAT BioQuest, and it was found to be 30.68 μg per ml, which comes under the quite active range. Conclusion, it was seen that from the antimicrobial test, it was seen that the copper nanoparticles were at par with the standard antibiotic discs for their antimicrobial activity. And it was also effective against the Mycobacterium tuberculosis strain H37RV. But this entire thing was done using the crude extract. So next we will be trying to isolate specific compounds and check their activity individually, and also their synergistic effect to see if that makes any difference. Thank you. Thank you, ma'am. Bio. I'm sorry, ma'am, I didn't get your first question. Can you repeat that again? Bio? I have not heard of this term. Okay, ma'am. So I have not dispersed my nanoparticles as yet. So far, I've just stored them in Eppendorf tubes. And I synthesize my nanoparticles as and when I use them. And for the antimicrobial activity where I used quite a bit of nanoparticles, I used the disposable Petri plates. So the plates were decanted and then discarded because the organisms that were used were quite infectious. Yes. Yes, ma'am. No, so far the only major assays that we've done were to check the antimicrobial and the antimicrobacterial activity, which was done at NIRT, and the other one was done in my lab. So all the nanoparticles that were synthesized were used in the process, and we disposed it along with the Petri plates. We decanted it and we had disposed it. But we will definitely be looking into this to see if there's a better way to dispose them.
How does the body dispose of nanoparticles?
Okay, sir. So when it comes to drug delivery, what happens is the nanoparticles are used in very small amounts and is generally coated with chitosan or cellulose, which the body generally eliminates. So the toxicity building that happens is very less, which is why the cytotoxicity tests are done. And it does not really have a lot of effect on the body cells otherwise.
I have one small technical question. So what is killing is nanoparticles, copper nanoparticles.
Yes.
So what is the benefit of using Ocimum sanctum aqueous extract?
Okay, sir. So all the plants, I have 9 other plants, but I've presented only one. So all the plants were selected based on literature and their anti-tuberculosis activity. So all the plants that I've selected do have anti-tuberculosis activity. So we were looking at copper because copper has not been explored so much, and copper has very good antibacterial activity as well. And in an aqueous extract, because I had also tried 7 other solvents, ethanol, methanol, and a lot of other solvents.
Okay, so I got the point. What you're trying to say is that these extracts contain some antimicrobial.
Yes.
But is that component carried over into those copper nanoparticles?
Yes, sir. So I did phytochemical tests for the extract as well as for the nanoparticles to find out what are the phytochemicals that are present in the nanoparticles. So, because we do say that after the synthesis of nanoparticles, there are some amount of biomolecules which aid in the synthesis and they disappear from the nanoparticle, right? So we did phytochemical tests for the nanoparticles as well, and we found out that initially there were positives for everything except for saponins. But for our nanoparticles, we still had 4 of the major phytochemicals present in copper nanoparticles also.
Any question from audience?
I think so that copper nanoparticle is also having the antibacterial activity, right?
Yes, copper.
So by utilizing this natural product, does that activity gets increased?
Yes.
One more question. What is the size of the copper nanoparticle that you have used, and does size also matters in the activity?
Okay. So we did antimicrobial tests for everything with just the extract, with my copper nanoparticles, and with just copper sulfate. And it was found to show that copper nanoparticles showed better zones of inhibition as against using just copper. Similarly, for antimicrobacterial work, I had used copper sulfate also as a control, And copper sulfate alone could not inhibit the growth of Mycobacterium tuberculosis, but my copper nanoparticles were able to. So that is the aqueous extract along with copper was able to. And the average size, I think in this thing I mentioned, 15 to 30 nanometers. And generally for any kind of drug delivery experiment, the nanoparticle, the smaller, the better it is. So anything lesser than 100 nanometers is good.
Very good afternoon to all. Myself Sneha from Central University of Rajasthan. I'm going to present a part of my PhD topic, the involvement of adipocytes in the regulation of tumorigenic potential of breast cancer cells. Now, it is already known that cancer is one of the most complex disease, and cancer mortality rate is still increasing despite of research efforts. When we talk about cancer, the tumor microenvironment plays a major role in flourishing and nurturing the cancer cells. Now, if we talk about breast cancer is one of the most common diagnosable cancer among women, and according to the latest reports, it is also one of the leading cause of death among women. There are many risk factors for breast cancer, and one of the major risk factors is obesity. Now, studies have already shown that a positive association is there between the body mass index and breast cancer risk. But how about obesity is associated with the cancer mortality rate is still unknown. And if we talk about at the cellular level, then how it is already known that adipocytes and breast cancer cells are involved in the crosstalk, and that promotes the aggressiveness of breast cancer. But does breast cancer cells can acquire adipocyte cell-like property is our major interest. So first of all, I have done the statistical analysis using the obesity data and the cancer mortality data and breast cancer at worldwide and USA population level. Data was procured for obesity and cancer mortality rate, and it can be seen that at worldwide level and at US population level, breast cancer mortality rate shows a positive correlation with obesity. My interest was also with the other cancers, so I performed statistical analysis, and it can be seen that if we see at worldwide level, not all cancer shows a positive association with obesity, but if we look at the USA population data, majority of the cancer shows a positive association with obesity. The reason can be this, that if we talk about it worldwide level, differences exist between the diet, genetic and lifestyle. So, and if we talk about USA population, there is less disparities exist. Now, concluding to this slide, I wanted to know what happens at the cellular level. So I used the 3T3L1 as an adipocyte cell. And first of all, I cultured 3T3L1 cell line and prepared a conditioned media, and then assessed its effects on MD-MB231 triple negative breast cancer cell line, and performed cell cytotoxicity migration assay. And it can be seen that in the presence of 3T3L1 conditioned media, the cell viability increases, the gap between the two ends also increases, and expression analysis was also done using proliferative markers like BCL-XL and EMT markers JEB1, JEB2. And it can be seen that in the presence of conditioned media of 3T3L1, their expression increases. Now, to assess the effect of 3T3L1 conditioned media on invasiveness of breast cancer cell, classical gelatin gyroscopy experiment was done, and it can be seen that the MMP activity was increased. Similarly, to again revalidate this, we performed the transwell invasion assay, and in the presence of 3T3L1 conditioned media, the more cells were invaded. Now, to assess its effect on colony formation and stemness property, colony formation assay and soft agar assay was performed. Cells were treated with the 33L1 condition media alternatively for 5 days for colony formation and for 8 days for soft agar. And then cells were stained with the crystal violet in colony formation, and it can be seen that the number of colonies and the size of colonies increases in the presence of 33L1 condition media, and the number of spheres also increases in the presence of 33L1 condition media. Similarly, CD44, which is a breast cancer stemness marker, was also, I guess it is not showing. That was also increased in the case of 33L1 condition media. Now, since breast cancer cells nurtured in the presence of adipose-rich microenvironment, so it can be concluded that the condition media is helping the aggressiveness of breast cancer. Now, my interest was whether a breast cancer cell can acquire adipocyte cell-like property. So for that, I have checked the expression of adipocyte marker genes like PPR gamma, which is the major transcription factor of adipocyte, paralipin 1, which is a lipid surface protein, leptin and adiponectin, fatty acid synthase and lipoprotein lipase, which are the late marker of adipocytes. And at the basal level, MD-MB231 shows its expression. Then classical lipid staining was done using the oil red staining in MD-MB231 cells and using hematoxylin as a counter stain. And it can be seen that small red dots present the oil red droplets, which shows that cancer cells can accumulate lipid droplets. Now, since then I used BMP2. BMP2 is a bone morphogenetic protein 2, which is the main regulator of osteoblast-like cells. But I was interested to know what is its effect on adipocyte-like cancer cells. So what I did is I treated my cells with BMP2, and in the presence of BMP2, more positive oil red staining can be seen, which was also further confirmed by the expression of PPR gamma, leptin, paralipin, and it shows that in the presence of BMP2, our adipocyte marker PPR gamma, leptin, and paralipin 1 increases. Now, metformin, as everyone knows, is a classical diabetic drug, and literature also suggests that metformin has suppressive effects on adipogenesis. So I use metformin to see whether metformin can inhibit the adipocyte-like cell property in breast cancer cells. So lipid oil red staining was done, and further oil red data shows that there is a decrease in lipid formation. Further expression level was also checked for PPR gamma, leptin, and paralipin 1, and it shows that in the presence of metformin, the expression of 3 was decreased. Further, I wanted to see their combined effect. So I performed this experiment, and as the data show, when the cells are treated with BMP2, there is an increase in the number of lipid droplets. And when there is metformin, there is decrease in lipid droplets. But when combination are used, the metformin inhibits the effect of BMP2. So concluding this, first of all, what I did is I did the statistical analysis using obesity and cancer mortality rate data. Then I was interested to know what happens at the cellular level. So I concluded that adipocyte condition media enhances cell proliferation, viability, migration, invasiveness, stemness in breast cancer cells. Now, then further, I wanted to know whether breast cancer cell can acquire adipocyte cell-like property. Then it was confirmed that breast cancer cell shows the adipocyte marker genes and positive oil red staining. Further, BMP2 treatment was done that confirms that BMP2 increases the adipocyte cell-like property in breast cancer cells. And lastly, metformin was used as a strategy to inhibit this adipocyte cell-like property. A special thanks to Professor Umesh C.S. Yadav for providing us the 33L1 cell line, and thank you INCT 2022 for providing the stage.
Okay, first, any questions from the audience?
Ma'am, you showed a positive association between obesity and breast cancer of USA population. So why not for India?
Actually, I tried to procure Indian data, but there is a national cancer registry program also, but I was not able to procure the data for all the states. So there was there was a non-uniform data. So then statistical analysis cannot be done for that.
Thank you.
So you showed gelatinolytic activity, right?
Hmm?
You showed gelatinolytic activity,
Yes,
right? So that was MMP2 or MMP9?
MMP9, sir.
You didn't see MMP2 on the gel?
No,
Sure.
MMP9.
Okay.
Thank you very much.
Thank you.
Thank you. You want to ask something? Yeah, please hold on. Yeah.
May I know the composition of your conditioning media?
Hmm?
The media which you have used for your differentiation of 3T3L1. What is the consequence? Like which media you have used for that?
I basically use the basal media. I am not using any differentiation media. I'm working on it currently.
But the 3T3L1 is the pre-adipocyte, no?
Yes, yes.
So
yes.
if you are connecting it with obesity, then you must be needing the mature adipocyte. And for that, we generally
But
use.
the effect of pre-adipocyte and mature adipocytes are entirely different. That's what I'm observing in recent.
So, but in that case, the 3T3L1 is not mimicking your obesity model, right? Because it's just it is just the
You can
pre-adipocyte.
say it is kind of a preliminary validation we are just performing.
So you did not differentiate your 3T3L1, is
No,
that?
no, we have differentiated, and I do not have much data to show. That's why.
Thank you.
Okay, thank you, Sneha. So I think I'll just say a couple of sentences before I end from my side. So it was very interesting to see all the student members present. I think this probably some of you may have spoken earlier, but the thing is that at least as a chairperson, I like the way students are presenting. Of course, there is always scope for improvement. One small suggestion that I will always give, especially for the student community, is that whenever you have limited time and when you are trying to impress upon other people, try to figure out what is the trump card in your presentation. Okay, let everything boil down to that particular point. So there has to be one protagonist in your presentation. Identify and spend more time speaking about that rather than doing too much of introduction. When you have time, that's fine. But when you have very short amount of time, you have to be very smart. The idea is to convince us and not to show how much you know, but to change our minds, no? Right? I don't know whether you would have anything else.
We agree. It's, I'm a teacher. He's a hardcore researcher. So basically conveying your stuff to the other person is weaving a story. Create a central character and then sell that central character, sell your story. So then you can be, of course, much more effective. But it has been a fantastic attempt. All of you have been superb. We have been given this responsibility to choose the best. And I know it's going to be hard for us. It is just one best presentation. So, but doesn't matter who gets the best. You all have performed wonderfully well. And I wish you all the best, all the success for your future endeavors. All the best. We enjoyed it.
Thank you so much. So this brings us to the end of this session. I thank Dr. Limai and Professor Rajpal for chairing this session. And now I request Dr. Amod Kumar to present mementos to our chairpersons. With that, we conclude this session. Thank you very much to be here. Good evening.
Good afternoon, all of you. Welcome you in this session 2C, Doctoral Student Award session. I invite Chairperson Professor A.K. Singh and Professor Ruby Chonento to chairing this session. A.K. Singh sir is a faculty in Department of Zoology. He was member of many professional bodies. He being reader to Magad University. He was a postdoctoral fellow in Max Planck. He served Department of Zoology, University of Delhi from 1985 onwards. Professor Ruby Chonento, she is a fellow of Chrysler, and she's also visiting. She's a visiting scientist, Department of Bioimmunotherapy, MD Anderson Cancer Center, Houston. She's also being awarded as a. She's also a fellow of National Academy of Science India, fellow of Academy of Science Thiruvananthapuram. Excellence Award for Outstanding RGCB is also given to her in 2015. She's also 2005 Young National Women Bioscientist. Ma'am, I invite you formally, ma'am and sir, both of you, to chair this session. Kindly proceed.
By tapping on this one table, I will tap, and when you consider that 9 minutes is over, and 10 minutes and maximum 1 minute additional, and beyond this, then there will be some cut in your marking. Now,
okay, the first speaker is Varsha D. Shiraga. Yeah, the topic is the inhibitory role of vitaferin A on high-fat diet-induced non-alcoholic fatty liver disease and hepatocellular carcinoma.
Good evening, one and all. I am Varsha from JSS Medical College, Mysuru, pursuing PhD under Dr. Prasanna K. Santikadur. Today, I am presenting on the ameliorating effect of vitaferin A on high-fat diet-induced non-alcoholic fatty liver disease and hepatocellular carcinoma via nuclear receptor LXR alpha. So, according to many literatures, more than 1 million people are affected. More than 1 million people are affected with liver diseases. Among them, non-alcoholic fatty liver disease is considered one of the common factors. In fact, non-alcoholic fatty liver disease is a common etiology for hepatocellular carcinoma as well, which is affecting 25% of general population. So there are many stages of liver diseases in obesity-induced NAFLD. So when excess consumption of high-fat, high-calorie diet without physical activity increases fat accumulation in the liver, which further which leads to a condition called non-alcoholic fatty liver. This damage caused due to the fat accumulation leads to inflammation, which further leads to the condition called non-alcoholic steatohepatitis. If untreated, it leads to hepatocellular carcinoma. So there are many drugs, not many, there are very few drugs available in the market to treat HCC or NAFLD. Among them, sorafenib and obeticholic acids are the drugs which have many side effects. So natural products can be used as a novel and effective therapeutic strategies in the treatment of NAFLD and HCC. Among them is vitaferin A. Vitaferin A is a naturally occurring steroidal lactone which has been isolated from Withenia somnifera plant, isolated from roots, leaves, and berries of this plant. And this the structure of vitaferin has a cholesterol backbone. Main use of natural compounds in treating these diseases are because it has antioxidant and anti-inflammatory effects. It has many health benefits as well as it has no very less side effects. So coming to hypothesis, as stated earlier, liver undergoes many stages, multiple hits to reach HCC. So our hypothesis was, will vitaferin inhibit NF-kappa B transcription factor as it is known as master regulator of inflammation. So coming to methods and results, upon approval from Institutional Ethics Committee, we procured Swiss albino mice and we had given high fat diet and high calorie diet to Swiss albino mice up for 8 weeks. And after 8 weeks, these obesity induced NAFL mice had treated with 1.25 mg of vitaferin for different time intervals such as 12, 16 and 20 weeks. As coming to results, as seen here, vitaferin treated mice group has gradually decreased body weight, as well as we can see a gradual decrease in adipose tissue weight as well mass when compared to high fat diet group. And so graph depicts the same here. And also we check for the blood glucose levels in the serum of these mice samples. As seen here, vitaferin treated group has gradually decreased glucose level in serum when compared to high fat diet. So when liver is damaged, there is an increased level in the enzymes such as aspartate transaminase, alanine transaminase, as well as alkaline phosphatase. When checked for these enzymes using commercially available kits, we could observe that vitaferin treated mice group had decreased the concentration of these liver enzymes when compared to high fat diet group. Also, we check for the lipid profile. As seen here, triglycerides, total cholesterol, and LDL has been gradually decreased in vitaferin treated mice compared to high fat diet or Western diet sugar water fed mice. And HDL is a good cholesterol, and we could see here HDL concentration has been increased gradually in different time course in vitaferin treated mice compared to high fat diet fed mice. As seen in the picture, high fat diet group had accumulation of more fat in the liver, in the hepatocytes, and vitaferin treated group had gradually decreased fat accumulation in the liver. And also we subjected section for H&E staining, and we could see here in high fat diet fed group, there is more of fat accumulation in the liver as well as hepatocyte ballooning. And in vitaferin treated mice, we could see gradual decrease in fat accumulation and also inflammation in the liver sections. And also we could, this graph depicts in the decrease in liver weight when compared to high fat diet fed mice. And also we checked for the inflammatory markers using mRNA in the mRNA levels using qPCR. And also we could see that many inflammatory markers such as TNF alpha, IL-6, IL-beta and MCP1 concentrations has been decreased in vitaferin treated mice compared to high fat diet fed mice. So when liver is damaged, when it activates Kappa cells, which further activates stellate cells. This causes fibrosis. TGF-beta is a fibrosis marker, and scar tissue replaces healthy hepatocytes. To check this, we subjected the sections for MTS staining to check the fibrosis level, and we could see high fat diet fed mice had more fibrosis and collagen accumulation in the sections, and vitaferin treated mice gradually decreased the collagen accumulation of fibrosis in the treated groups. And also we checked for TGF-beta1 secretion in serum levels and using ELISA assay, and found out that vitaferin treatment gradually decreased with TGF-beta concentration in serum compared to high fat diet in high fat diet. And also collagen markers, which are TGF-beta target genes, found out that vitaferin has gradually decreased the collagen markers and compared to high fat diet fed mice. So using QGY7703 cells, these are the hepatocellular carcinoma cell lines. We checked for the angiogenic and cytokine marker. markers using commercial angiogenic and cytokine array kit. And the red marked genes are angiogenic and cytokine markers, which are gradually downregulated upon beta-ferrin A treatment when compared to control group. Using bioinformatic tool, we found out that these downregulated genes have NF-kappa B binding sites on their promoter region. So we know that our literature surveys tells that elixir alpha is a negative regulator of NF-kappa B signaling, and activated by beta-ferrin A may downregulate the secretion of all these molecules while suppressing NF-kappa B activity. We wanted to check through what mode does beta-ferrin A downregulates all these markers, or does through which receptor does beta-ferrin A downregulates all this. So we performed molecular docking to check will beta-ferrin A binds to elixir alpha. So molecular docking results also showed there is a strong binding affinity of beta-ferrin A that binds to elixir alpha. To further validate this, we checked for many elixir alpha target genes in HepG2 cells. We treated HepG2 cells with or without beta-ferrin A, and found out the mRNA and checked for mRNA levels for these target genes, and found out that these target genes have been gradually increased in beta-ferrin A treated mice when compared to control group. So we can say that yes, beta-ferrin A acts as an agonist or ligand to the elixir alpha receptor. So coming to key findings, as told, beta-ferrin A binds to elixir alpha, and as a downstream mechanism, we can see here that beta-ferrin downregulates the inflammatory markers as well as TGF-beta, and as well as HCC hallmarks or angiogenic and cytokine markers as well. And we can say that beta-ferrin A can be used as one of the best molecules to be treated for NAFLD and HCC. So I would like to thank my guide, Dr. Prasanna K. Santekatur, and all the funding agencies for the providing of funds. Thank you.
So in that AST levels.
Yes, ma'am.
Yeah. So that red one is the control, right?
Yes, ma'am.
Yeah. So what is that black one?
Black one is just control, vehicle control.
So you are finding a decrease by the compound. So you are finding an NF-kappa B correlating.
Yes, ma'am.
Then why did not check for NF-kappa B binding?
As seeing here, we using bioinformatic tool only, we could see that those genes had NF-kappa B binding sites. So there is that's why we do
that will be good if you can do.
Yeah.
Instead of
further we have many other
checking like this, you can just check whether it is downregulating.
I mean, we are still doing the work actually, but this is the presenting
it is
data.
a nice piece of work.
Thank you.
Devika Chopra. The topic is gingiber officinale as an adjunct enhances the chemotherapeutic potential of temozolomide in experimental model of glioma and mitigates redox profile.
Good evening to all. I am Devika from Department of Biophysics, Punjab University, and working under the supervision of Professor D.K. Dhawan and Dr. Vijeta D. Chadda. And the topic of my presentation is zingiber officinale as an adjunct enhances the chemotherapeutic potential of temozolomide in experimental model of glioma and mitigates the redox profile. Brain cancer is a cancer that arises within the brain and that starts and stays within the brain. And it is a heterogeneous type of cancer that includes multiple brain cells. For example, gliomas. Gliomas is the invasive tumor of glial cells within the brain. And the incidence of global incidence is reported. Here we can see the global incidence annually reported in US and the mortality rate of around 229,000 annually. So WHO has classified brain cancers from grade 1 through grade 4. Grade 1 specifies the low grade brain cancers that includes meningiomas, and grade 3 and 4 includes highly aggressive tumors, which includes astrocytomas, oligodendriomas. Due to poor prognosis, the standard treatments are ineffective, which includes chemotherapy, radiation, and surgical interventions. The surgical interventions include craniotomy, due to which the tumor relapses because the entire removal of entire tumor tissue from the brain is not possible. Therefore, our interest has deviated from therapeutics to medicinal plants because they are non-toxic and inexpensive. And we have studied one of the bioactive component, zingeron, from which is extracted from ginger and exhibits various pharmaceutical actions, and has been used as an anti-inflammatory, antioxidant, anti-cancer agent in treating several diseases. This is the material method for inducing tumor in animals. We use C6 glioma cell lines, which were injected surgically into the rat brain, and we perform neurobehavioral tests to analyze the functioning of central nervous system and brain. Then at the end of the study, we did biochemical indices, which include ROS, LPO, enzymatic, non-enzymatic parameters, catalase, SOD, GSH. And further we confirmed that how a tumor invasion affected the functioning of the brain by histoarchitecture. This is the experimental design. Animals were stereotaxically implanted with C6 cells, 1 × 10⁵, and they were harvested freshly and suspended in phosphate buffer saline, and they were injected in group 2, 3, 4, and 5. Group 1 was the sham control group, in which only phosphate buffer saline was injected in the rat brain, and the neurobehavioral tests were carried out from day 0 till 28 days, and on 30th day the animals were fasted and their brain tissue was harvested for biochemical and histoarchitectural studies. In the studies, we can see in figure 1, the tumor was in 1A, we can see that tumor was visible. The tumor volume was ranged from 150 to 250 mm cubes in the animals inflicted with C6 cells, whereas in other treatment groups, no visibility was observed, and little of inflammation was observed in group administered with zingeron. Here we can see it is shown by a black arrow in figure 2. And at the end of the study, we analyzed the change in the body weights of the animals from day 0 to 28 days. And during this duration, no decrease was observed, but on day 28, we observed significant decrease in the body weights of animals inflicted with C6 cells. However, this was improved by the administration of zingeron and temozolomide. Temozolomide was administered at the dose of 20 mg per kg body weight orally, and zingeron was administered at the dose of 50 mg per kg body weight orally. And this treatment was carried out throughout the study post inoculation of the cells. In the third figure, you can see the percentage survival. The sham control animals, there was no mortality. In the C6 inflicted animals, 50% of the animals died in the duration. However, Zingeron supplementation and temozolomide supplementation have shown not significant improved in the median survival, but there was less of mortality observed in other treatment groups as compared with the C6 inflicted groups. To further confirm our studies, we performed behavioral tests. First, we performed actophotometer, from which we observed the locomotor activity of the animals. This was done by recording the activity score, which was the ambulation and rearing motion of the animals. As you can see in the separators, the movement of animal was significantly reduced in C6 inflicted group on day 28, as you can see when compared with the sham control group. However, this was improved by the supplementation of Zingeron and temozolomide. Similarly, the muscle strength was recorded by performing rotor or treadmill tests. In this, we analyzed the mean fall time taken by the animal, and we recorded that on day 28, the C6 inflicted animals showed significant decline in the muscular strength as compared with the sham control. However, the muscle activity was restored by administration of Zingeron and temozolomide. This is the elevated plus maze test, which was done to analyze the anxiety-like behavior in animals. This is the apparatus. The more time spent by the animals in open arm represents the anxiety behavior. In above figure, you can see that C6 inflicted animals exhibited higher anxiety-like behavior by the end of the experimentation, which was significantly decreased by supplementation of Zingeron and temozolomide. Similarly, time spent in closed arm was recorded, which was opposite of the time recorded in the open arm. To further validate our study, we did redox profiling, in which we have performed biochemically reactive oxygen species level, lipid peroxidation, enzymatic, non-enzymatic antioxidants. As we can see, redox intensity was significantly increased in C6 inflicted animals, which was due to the production of free radicals. And in these groups, the levels of antioxidant enzymes were also decreased because they were not able to antagonize the generation of free radicals. That why catalase, SOD, and GSH levels were reduced in C6 inflicted animals. However, this was improved by supplementation of Zingeron and temozolomide. In histoarchitectural study, you can see in B that infliction of C6 cells caused infiltration around the tissue and anaplasia. That means the cells, these are the tumor cells that has spread around the site of injection. However, this was reversed by the administration of Zingeron. And further, the pycnosis in figure E that occurred due to administration of temozolomide was reversed in figure D, which is the combination group by the administration of Zingeron. Hence, we can engross from our study that C6 inflicted cell caused tumor formation, reduced body weights of the animal, reduced motor and anxiety behavior, increased oxidative stress markers, reduced antioxidants, and includes cellular infiltration, which was reversed by the administration of Zingeron, a phenolic bioactive component of ginger. And also it helped in reducing the side effects that occurred due to temozolomide treatment. Thank you.
One question asked thank you.
Thank you.
And one thing I think some part of the that much just percentage of methodology and solution. Now we have next speaker.
The next speaker is Ayushi Garg. The topic is novel seleno derivatives of conventionally available HDAC inhibitors demonstrate promising chemotherapeutic potential in an experimental model of colitis-associated colorectal cancer.
Good evening, everyone. I'm Ayushi Garg from Department of Biophysics, Punjab University, Chandigarh. Today, I'm here to present my work on the title, Novel Selenium Derivative of Conventionally Available HDAC Inhibitors Demonstrate Promising Chemotherapeutic Potential in an Experimental Model of Colitis-Associated Colorectal Cancer. So starting with the introduction. Selenium, a micronutrient and established antioxidant, appears to have cancer preventive properties and also involved in various biochemical pathways like redox regulation, antioxidant and anti-inflammatory function in various inflammatory or chronic diseases. Also, selenium modulates various epigenetic events like DNA methylation or inhibition of various histone deacetylase activity through selenium metabolism product. As we all know that altered HDAC expression play active role in tumor onset and progression, thus making them a viable therapeutic strategy. So keeping this in mind, we have used a conventionally available HDAC inhibitor, that is SAHA, sebriol anilide hydroxamic acid, but due to its limited efficacy and unwanted side effect, there was an urgent need for more effective and consistent drug. So in this regard, the current study was aimed to potentially enhance chemotherapeutics of selenium derivative of SAHA known as SelenoSAHA-1 for the treatment of colitis-associated colorectal cancer. This is the experimental design where the animal were assorted into 5 different groups. First, control, where animal were kept on normal diet and water. Second, vehicle, where animal were kept on normal diet and water, followed by 2% of DMSO, which is the vehicle for drug as well. Third is the disease group, where animal were administered with azoxystrobin dose at the 100 mg per kg, followed by 3 cycle of 2.5% dextrose sodium sulfate. Now these two are the treatment group, that is SAHA, where the animal were administered with IP at the dose of 100 mg per kg for 21 days. Similarly, SelenoSAHA were administered at the dose of 25 mg per kg of body weight for 21 days. And the dose which I have taken was previously standardized in our lab. Now moving towards the result. This is the in vitro cytotoxicity data where the MTT assay was performed on various cancer cell lines like colon cancer cell line, primary colonocyte cell and normal cell line to evaluate various IC50 and to check the cytotoxicity of both the drug at different concentration. So through table 1, it is clear that at the time of HCT 115, the IC50 of SelenoSAHA is much lower than that of SAHA, which represent it is more effective even at lower concentration. Similar result was observed at the time of primary colonocyte cell isolation that has been done from colon mice, and the same result was obtained at IC50 of SelenoSAHA was much lower than that of SAHA. As when cytotoxic assay was done on normal cancer cell and normal cell line, the result shows that IC50 of both the drug was comparable and they are non-toxic to the normal cell. So this all in vitro data shows that SelenoSAHA is much more effective at low concentration than that of SAHA. Now moving towards the in vitro efficacy that we have performed in Balsi mice, the graph A shows the changes in the body weight of animal in different treatment group. As the animal is in AOM and DSA shown by the green color, there is the decrease in the body weight as compared to control and vehicle, with the sign of restoration better in case of Selenosaha shown by the pink color as compared to Saha shown in blue color. Likewise, this is the Kaplan-Meier curve graph showing the percentage survival of animal in different treatment group, and in AOM DSS shown by green color, the survival rate of mice is less than that of all treated group. Graph C shows the pictorial representation of colon length shortening, as colon length shortening is the classical hallmark of cancer, and the shortening of colon was observed in AOM and DSS group as compared to control and vehicle. Whereas graph D shows the bar graph representation of colon length only. Moving towards the colon length weight, there has been increase in the colon length, colon weight due to the presence of tumor or increase of the tumor incidence in case of AOM and DSS as compared to control and vehicle, with the favorable modulation with Selenosaha 1 as that of Saha. Now, by checking to the anti-inflammatory potential of both the drug, myeloid peroxidase activity was checked, and myeloid peroxidase expression increases when there is more inflammation and hence more neutrophilic infiltration. So in case of AOM and DSS, there is more inflammation and hence more activity of MPO as compared to control and vehicle, which has been reduced in case of Saha, but not statistically as in case of Selenosaha 1. Now, this is the gross morphological representation of animal in different treatment group. In case of AOM and DSS, there is maximum morphological insult was observed as shown with the blue color circle in compared to control and vehicle, whereas the sign with mild inflammation has been resolved better in case of Selenosaha 1. Now the table 2 showing the evaluation of multiple plaque lesion in of all the treatment of all the group where AOM and DSS have shown 100% tumor incidence, which has been reduced to 62% in case of Saha and further to 37% in case of Selenosaha 1. So all this result shows that Selenosaha have more therapeutic index as compared to that of Saha. Now, this is the histopathological analysis of animal in different treatment group. In case of disease AOM and DSS, there is maximum neutrophilic infiltration shown by the orange arrow in the form of blue dots, and the black arrow shows that there is crypt distortion and crypt has become more wider and fewer in number as compared to control and vehicle. Whereas when compared between Selenosaha 1 and Saha, Selenosaha 1 has shown more chemotherapeutic index as that of Saha, as it has attained its morphology similar to that of control with normal crypts. Now, ROS-dependent oxidative stress play a central role in the physiology of colitis-associated colorectal cancer. So, enzymatic and non-enzymatic antioxidant profiling was done, and from graph A to D, it has been shown that activity of various antioxidants like catalase, GST is found to be increased in case of AOM and DSS, whereas activity of GPX and GR is found to be decreased in case of AOM and DSS as compared to control and vehicle, with a sign of favorable modulation better in case of Selenosaha 1. As you can see, in case of GPX, there is a selenium dependent increase in the GPX activity, which is a selenoprotein, and hence there is an increase in the antioxidant capacity. To validate this finding, non-enzymatic antioxidant profiling was done, whereas where LPO, DCHFD and nitric oxide expression was found to be increased in case of AOM and DSS as compared to control and vehicle, which also proved that Selenosaha favorably reduced the oxidative stress marker and thus sustained the redox homeostasis. Likewise, this is the gene expression profiling of various HDAC class through RT-PCR. As we all know, the HDAC expression increases in case of cancer. So this also validates that there is establishment of colitis-associated colorectal cancer, and increase in HDAC 1, 3, 8, 6 has been found as compared to control and vehicle. Also, Selenosaha normalized the expression better, as this also correlate with our in silico data not shown here that Selenosaha bind differently to different catalytic pockets of various HDAC as that of Saha. Similarly, these are the gene expression profiling of various inflammatory and pro-resolution marker, which also proved that Selenosaha might interact with various inflammatory process to the downregulation of COX-2 and its downstream pathway like IL-10, TNF-alpha, and many more. To further validate, these are the protein expression profiling, which also proves that Selenosaha favorably modulates better than that of Saha in each protein that I have shown, like COX-2, GPX, IL-1 beta, So we can conclude that the enhanced anti-inflammatory and chemotherapeutic potential of selenosome might be due to the manifestation of essential tracer element selenium in it. Also in context of inflammation, downregulation of various COX-2 and pro-inflammatory genes can occur, and also the expression can be due to the different binding to different catalytic site on different HDACs. These are the references. Thank you. Thank you, sir. Then mg per kg of body weight singly, we have given A1 singly, single dose at the dose of 10 mg per kg of body weight, followed by 3 cycle of 2.5% dextrin sodium sulfate.
Okay. How long you kept the experiment?
To 12 weeks, 11 to 12 weeks. And after that, we dissect the animal and check the histopathological analysis.
Okay. Okay. Thanks.
Right. Thanks.
Yeah, the next speaker is Ramanpreet Kaur, and the topic is selenocoxib-3, a novel selenium derivative of celecoxib, effectively resolves colitis by alleviating gut dysbiosis and maintaining membrane integrity.
Good evening, everyone. My name is Ramanpreet Kaur. I am doing PhD in Department of Biophysics under supervision of Dr. Naveen Kaushal, Punjab University, Chandigarh. My topic for today's presentation is selenocoxib-3, a novel selenium derivative of celecoxib, effectively resolves colitis by alleviating gut dysbiosis and maintaining membrane integrity. Ulcerative colitis is a subtype of IBD, which is a inflammatory disorder of colon in the gastrointestinal tract. Almost around 6 million people worldwide are suffering from inflammatory bowel disease. Symptoms of UC include abdominal pain, diarrhea, rectal bleeding, etc. It is a disease with unknown etiology. However, genetic, environmental, and lifestyle factors, along with the gut microbiota, are thought to be involved in its pathogenesis. So the figure below indicates incidence of IBD and UC worldwide. With the red and yellow indicates the highest incidence. The Western countries are known to have the most affected countries because the Western lifestyle and the diet are believed to be the culprit behind this. So as the etiology of UC is complex, host genetic factors and increased microbiota, they collectively enhance the pro-inflammatory cytokines at the site of inflammation in the colon tissue. And then various migration of neutrophils and macrophages take place at the site of inflammation in the colon, which further enhance the inflammatory response. This uncontrolled inflammatory response is responsible for reactive oxygen species generation and thereby oxidative stress. So, however, whether the gut dysbiosis is a cause of ulcerative colitis or it is an effect of ulcerative colitis, it is not yet clear. Nevertheless, there are many treatment modalities which are available to manage UC, NSAIDs being the most widely used and widely prescribed drugs were used currently in our study. So NSAIDs are of 3 types: non-selective, semi-selective, and selective. Selective NSAIDs are the most safer ones when compared with other NSAIDs because they inhibit only the COX-2 isoform of the cyclooxygenase enzyme. However, unlike other NSAIDs, which inhibit COX-1 isoform also, which is necessary for maintaining the gut homeostasis. However, even though the selective NSAIDs are safer, studies have revealed that the prolonged use of selective NSAIDs and at higher doses is associated with various cardiac, renal, and hepatic side effects. So keeping this in mind, selenium, which is a potent antioxidant, is well established in various diseases. More specifically in ulcerative colitis, it is very well known. Previous studies from our lab have already established the protective role of selenium against the experimental colitis. Dietary selenium against experimental colitis. So keeping this background in mind, we have incorporated selenium chemically in the selective NSAID celecoxib to synthesize a novel compound, selenocoxib 3, to check if there is any improvement in its efficacy and lesser toxicity. And initial study, which we have already published, have revealed that selenocoxib 3 was less toxic and more effective when compared with its counterpart. However, further studies which are currently I will show were done to check if there are any protective effects of selenocoxib 3 on membrane dynamics, membrane fluidity, or membrane permeability and gut dysbiosis. So currently this is the experimental design of the study. Study was divided into 5 different groups. And it was done using biopsy mice of weight range of 20 to 25 grams. Control group was throughout the experimentation, it was on normal diet and water. However, vehicle group was on diet and water for 16 days, followed by 0.5% DMSO intraperitoneally for 7 days. The rest of 3 groups were on 3.5% DSS for 16 days and followed by normal water in DSS group and 10 mg per kg celecoxib in DSS plus celecoxib group, 5 mg per kg selenocoxib in DSS plus selenocoxib group. The doses of celecoxib and selenocoxib were standardized initially based on anti-inflammatory, toxicity, antioxidant and pharmacokinetic profilings. So coming on to results. So since membrane integrity is a very vital physiochemical property of cell membrane, so decreased membrane integrity is well established in various diseases, which was also observed in our study with where increased permeable fluidity and increased membrane permeability was observed in DSS group when compared with control and vehicle groups. So, however, there was no significant increase was observed in celecoxib and selenocoxib group when compared with control and vehicle, with selenocoxib 3 showing better protective effects than celecoxib in membrane permeability studies. Further, similar results were observed when in genetic gene expression studies of various tight junction proteins, claudin-1, occludin-1 and cadarin, where also it was observed that selenocoxib was more potent than celecoxib. It helps in normalizing the membrane integrity, which might be due to its the presence of selenium in the selenocoxib 3. So since membrane permeability is associated with the decreased absorption of nutrients, membrane transport of glucose was studied across the colon tissue at the different temperature, concentration and time. And in figure A, it was observed that at all the temperatures, there was a significant decrease in the transport in DSS group animals. However, there was a selenocoxib 3 showed a significant enhancement of the transport when compared with DSS group. And similar results were observed for when in concentration and time related studies. So at last, since gut microbiota and UC are very interrelated, so currently we observed the relative abundance of various bacterial phyla in the fecal tissues of, in the fecal matter of different treatment groups. So it was observed that Bacteroidetes, which is a bad class, which are bad bacteria, and Firmicutes, which are good bacteria, were significantly altered in DSS group with an increase in the Bacteroidetes in DSS group and a decrease in Firmicutes in the DSS group. So as we can see, there Selenococcib 3 tried to normalize the diversity of the bacterial phyla through its maybe through the translation of selenium into the selenoproteins. Also, the increase of alpha protobacteria and actinomycetes are also associated in their increased relative abundance is associated in ulcerative colitis, which was also very well normalized by Selenococcib 3, which was better than Celecoxib. So to conclude, current study focused on the cross-sectional relationship between inflammatory process and biophysical properties of the membrane and their effective resolution by novel selenoderivative of celecoxib, demonstrating translational feasibility of selenium analogs of COX-2 inhibitory NSAIDs in managing acute and chronic inflammation more effectively with broader safety margins. Of note, the contribution of gut microbiota in UC-associated inflammation is obviously unquestionable, but yet more complex than a simple imbalance of relative abundance in phylum. The bacterial targets focused in the present study could be further evaluated in the future for better understanding of the factors involved in disease pathogenesis. Thank you.
It's a good presentation. The selenoderivatives, what it is actually? Is it a protein? Or
It is a compound, chemical compound.
What is that compound? What is the nature?
Sorry?
What is that compound actually?
It is actually NSAID. It's a normal drug, which what we actually have done is it's a normal drug, celecoxib, which you normally eat in any kind of inflammatory and pain related problems. So what we have done is we have chemically, it's a scheme.
No, my question is specific. Is that protein? Or
no, it's not a protein.
Okay, then at what form selenium is incorporated in that?
Sorry?
What is the form of selenium in that?
It's a chemical form. Sodium selenite was incorporated into the drug.
Okay, means
Yes.
it's artificially synthesized.
Yes, 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 sir.
You have synthesized that.
Yes, our collaborators have synthesized it.
What is the way you are quantifying that one?
Sorry?
How you are quantifying the selenococcib 3?
Quantifying as such how much selenium is there.
Yeah.
We have actually not done it yet. How much selenium is actually in the drug in the form of selenococcib, because the mechanism of drug is not clear. We are not.
It is a selenium incorporated compound. There is a ICP-MS. We can quantify using ICP-MS,
Yes,
right?
yes, sir.
So what is in what manner you quantified it without knowing that? Optimizing all the concentration.
Because
and other
there
things?
are initial studies are already done in this drug, and they have done NMR and MS studies using this, and they have in vitro, and they have observed that its efficacy was already observed and toxicity. However, is whether actually selenium works in with selenoproteins actually in the body.
I know.
So yes, so
know.
that is the problem. So
Yeah, just selenoproteins. It is there in the form of selenocysteine, right? You
yes,
have
sir.
mentioned
Yes,
also.
sir.
Is that selenocysteine or selenomethionine or either pre-amino acid or it incorporated as a
So
selenoprotein?
that is just a hypothesis that it might have in the drug that it might have dissociated from its other part of celecoxib and it gets into the selenoproteins and its normal biosynthesis, but it's just a hypothesis.
All right,
Yes,
but
sir.
we work on selenoprotein. It is in the form of selenocysteine and selenomethionine.
Yes,
We
sir.
quantify using ICP-MS. We do have the antibody for it.
Okay, sir.
Yeah, okay.
Thank you.
I have a small question. Why did you choose DSS as IP, not as oral?
We have used DSS as oral.
Okay.
Yes.
But I have
IP was the drug. The selenocoxib and celecoxib we used as intraperitoneally.
Okay, then I have one more question. Does gut microbiota profiling now? How did you did that?
Actually, we have isolated the DNA from fecal.
Which method you used?
We used KIT for isolation of DNA, and
Okay,
then we have
profiling
done
for profiling.
Then we did real-time PCR of the DNA.
With real-time PCR?
Yes, with the real-time PCR using the primers for specific sets.
Using the primers for specific bacteria?
Yes.
Okay.
Phylums only.
Okay,
Yes.
I didn't know that. First time I'm hearing. That's
Okay.
right.
Okay, thanks. Next speaker is Pranab K. Sahu, and the title is Association of CYP3A4 and GSTP1 with its clinical impact in oral cancer patients undergoing induction chemotherapy.
Good evening all. I, Pranab Kumar Sahu, working as a PhD research scholar at the Department of Pathology and Cancer Screening, Chittaranjan National Cancer Institute, and Department of Pharmaceutical and Fine Chemical Technology, University of Calcutta. Today, I am here to present my work, Association of CYP3A4 enzyme and GSTP1 enzyme with its clinical impact on oral cancer patients undergoing induction chemotherapy. As we know, oral cancer is the part of head and neck cancer, and the oral cancer are more aggressive and lethal disease in case of lethal disease. And worldwide, when we combine with pharyngeal cancer, it stands 6 with new cases of 3.37 million and death of 1.75 million. Whereas India, it stood number 2nd after breast cancer with new cases of 0.35 million and approximate death of approximately 0.17 million. The common risk factor for oral cancer are mainly tobacco chewing and HPV infection, UV exposure, and bacterial infection, as well as alcohol consumption. In case of HPV infection, there is those having HPV positive with oral cancer, they have more better prognosis than those having oral cancer with negative with HPV infection. They have less prognosis, but the mechanism of this prognosis is still not yet clear. The main signs and symptoms of oral cancers are white and red patches, lump, swelling, sudden bleeding, trouble of chewing, and chronic sore throat. The main treatment for the oral cancer are surgery, radiotherapy, and chemotherapy. For the stage 1, the common treatment for oral cancer is surgery, whereas for the stage 4, the main common treatment option for oral cancer is chemotherapy. The chemotherapy drug that mainly used for oral cancer are paclitaxel, docetaxel, or cisplatin, carboplatin, or 5-fluorouracil. Paclitaxel are the drug that act as a microtubule stabilizer, where cisplatin act as a intercalating agent and 5-fluorouracil act as a inhibitor of thymidine synthase precursor. Here in this picture, we can see the drug that enter diffuse through the plasma membrane into the cell. These are conjugated by the phase 1 reaction. Then it is this metabolite, these genobiotics are modified by the GSTP1 in phase 2 reaction, and then these drugs are transported out from the cell. So here, in case of phase 1 reaction, CYP3A4 enzyme work. In case of GSTP1 work in phase 2 reaction. If there is a mutation in CYP3A4 enzyme and GSTP1 enzyme, there will be accumulation of more prodrug of metabolite drug of paclitaxel and carboplatin. So this causes toxicity in the patient, and this toxicity causes comprising of quality of life and overall survival. In our study design, we recruited total 215 of patients according to the inclusion exclusion criteria. Then patient underwent chemotherapy. After completion of chemotherapy, we went for clinical evaluation and toxicity profiling. Clinical evaluation done by using PET-CT, and according to RECIST criteria version 1, we are classified them as responder, non-responder, and partial responder. And according to CTC guideline, the toxicity are divided into toxicity grade 1, grade 2, grade 3, and grade 4. After underwent chemotherapy, we collected blood from the patient for genomic analysis. We done PCR RPLP and isolated blood. We isolated DNA from the blood by using phenylchloroform method. In this result, we can see most of the patients were aged between 41 to 60 years, where most of the patient, those who are most of the patient are male, and most of the patient belonging from the rural setup. Here we can see the most of the patient tongue was the common site for the patient. 39.3%, 39.33% contributed oral cancer, and the most common adverse effects are alopecia, diarrhea, vomiting, fever, nausea, and dysphagia. Here, after collecting the blood, we did the genomic analysis. We did PCR and PCR RPLP. From the blood, here we can see the product size of PCR product size is 225 base pair. After digestion with South A enzyme, they're giving different card. From this card, we can classify the patient as a poor metabolizer, intermediate metabolizer, and extensive metabolizer. In this cutting point, we can see those products having cut with 225, 114, and 1111 base pair. They are considered as a extensive metabolizer, where those didn't cut, we are considered as a poor metabolizer. From this result, by using Pearson chi-square code, we can see that the enzyme GSTP1 having strong association with diarrhea and dysphagia, but CYP34 didn't have any association with adverse effect. Now, from this result, we can conclude that the genotype distribution of CYP3A4 did not vary significantly with adverse event, whereas GSTP1 had a strong correlation with adverse effect like diarrhea. And therefore, we can conclude that CYP3A4 may not be a strong predictor treatment outcome of patients with oral cancer, whereas GSTP1 has strong correlation with adverse effect. Thank you.
The next speaker is Ritu Chauhan, and the topic is characterization and thermal stability studies of pharmaceutically important compounds from Arthrospira platensis.
Good evening, Chairperson, ma'am and sir, and to all which are present here. I am Ritu Chauhan. PhD scholar at MIT University, Noida, and today I am presenting here my research work. Topic is characterization and thermal stability studies of pharmaceutically important compounds from Arthrospira platensis, which is a blue-green algae. As we all know, blue-green algae is a oxygenic photosynthetic microscopic organism widely distributed in fresh water lake, marine sediments, and soil, etc. They also known for the production of secondary metabolites with diverse biological activities such as antibacterial, antioxidant, anti-cancer, and anti-diabetic. In this study, we have collected the samples from high altitude lake, Nainital, and Arthrospira platensis was isolated from Nainital, India, and was explored for the characterization of novel bioactive compounds. The study aimed to explore the potential of different BGA extracts for antibacterial activity against multiple antibiotic resistant bacteria and antioxidant potential. The bioactive compounds were characterized using GCMS and extract were further tested for their thermal stability. Here are the photographs of the samples and the sampling points. So isolation of BGA, that is Arthrospira platensis, was done using membrane filtration method in BG11 medium. For the further character and the further morphological characteristic was confirmed using SAM and the confirmed Arthrospira platensis by the 16S rRNA sequencing and the phylogenetic tree. For the qualitative assessment of phytochemicals in different extracts of Arthrospira platensis was done. We have taken 5 extracts, that is methanol, ethanol, ethanol, acetone, acetyl, DCM, dichloromethane, and the phytochemical analysis has been done and shown in the table in the form of presence and absence of the phytochemicals. Flavonoids and phenols are present in all extracts, so I have done quantitative estimation of TPC and TFC. That is estimated in the range of 12.23 microgram per gram to 45.17 microgram per gram. The TFC was reported in the range of 11.10 to 25.40 microgram per gram. I have done antioxidant potential of different extract of Arthrospira platensis, and the results are shown here. AP was found in the range of 15.23 to 89.21. Antibacterial assessment of crude extract of Arthrospira platensis was also done against multiple antibiotic resistant bacteria, that is E. coli, E. alberti, P. originosa, P. fluorescens, Staphylotyphium, Shigella dysentery, and the MIC of only methanolic extract was also done for the Arthrospira platensis. Maximum activity in terms of zone of inhibition was recorded in the case of methanolic extract against E. coli. I have also done the stability studies of the methanolic extract at different temperatures, that is 25 degrees centigrade, 40 degrees centigrade, and 40 degrees centigrade and 50 degrees centigrade. From 0 day to 63 days after 7 days intervals. And we have found that at 25 degrees centigrade, TPC and TPC level were quite stable. Here are the graph. I have also done GCMS analysis of the methanolic extract for the identification of the major compounds which are responsible for the activities. And I have selected for 5 major compounds on the basis of the percentage area, and that are pentadecanoic acid, phytol, heptadecanoic acid, oxirane, and octadecane. Here is now the major findings of my work. That I have selected high altitude Nanny Lake for the sampling and isolate A. platensis, HA and L01 crude and purified methanolic fraction show significant antibacterial activity. Phytochemicals, flavonoids and phenols were present in all extracts with varying level of antioxidant potential. The thermal stability of methanolic extract was determined at 25, 40 and 50 degrees centigrade for 63 days. And the degradation of TPC and TPC, TFC, antioxidant potential and antibacterial activity was observed in decreasing order. Crude extract were found stable at 25 degrees centigrade even after 63 days of storage. These findings certainly help pharmacies to determine the best storage conditions. We have identified 5 major compounds, namely pentadecanoic acid, phytol, heptadecanoic acid, oxirane, and octadecane. Out of them, pentadecanoic acid was reported as the main compound, as the spectra of this bioactive molecule were observed as the highest peak with a maximum heat. The result of the study showed that high altitude Arthrosphaera platensis is a good source of antioxidant and antibacterial compounds and could be used for further research in the field of drug discovery, particularly against multiple antibiotic resistant bacteria. And keeping this in mind, further in vitro and also in silico studies were required precisely to understand the mechanism of BGA, antibacterial antioxidant molecules, and their structural features for the development of novel bioactive compounds. Now I would like to thank my guide, Dr. Ashutosh Tripathi from Amity University, and my co-guide, Professor Subhash Chauhan from USA. Thank you so much.
Sushmita Ghosh, and the topic is role of sourcing in the development of multi-drug resistance against 5-FU, leucovorin, oxaliplatin, and docetaxel chemotherapeutic regimens in the gastric cancer subtypes.
A very good evening to the chairpersons and my greetings to the audience here. I am Sushmita, representing Chittaranjan National Cancer Institute. Today I'm going to talk about a part of my study entitled Role of Sourcing in the Development of Multidrug Resistance against 5-FU, oxaliplatin, docetaxel, and chemotherapeutic regimens in gastric carcinoma subtypes. This part of my study is entirely based on patient samples who have taken flawed regimens in the hospital, Chittaranjan National Cancer Hospital. Before driving down the road, let us introduce with the gastric cancer statistics. Gastric cancer is the 5th most common cancer worldwide, where it ranked 4th in India, and mortality-wise, it ranked 3rd in India. There are several eradication campaigns has been done around the world to against these gastric cancer risk factors like H. pylori eradications, behavioral awareness campaigns like against smoking, alcoholism, and lifestyle changes, and introduction of new treatment modalities like surgery, radiation therapy, and chemotherapy has shown to decrease the gastric cancer incidence rate along the period. However, the concern still remains with the increasing mortality rate. Chemotherapy, it is very effective. It is proven to be very effective initially when it is introduced for the gastric cancer patients, and it also found to increase the and prolong the survival rate among the gastric cancer patients. However, the development of multidrug resistance in the gastric carcinoma cells hinders the treatment, and it proves the treatment failure in chemotherapy. The emergence of multidrug resistance in cancer cells, they have adopted multiple strategies and mechanisms to fight against these given drugs. There are several multidrug resistant proteins such as polyglycoproteins, MRPs, sourcin, and ERK1/2. There are several newly discovered associated proteins has been found, and sourcin is one of them. It is a very interesting protein. As its name suggests, it is a soluble resistance related calcium binding proteins. It gets activated inside the body while binding to the calcium ions, and surprisingly, it shares the same chromosomal location as PGP, a polyglycoprotein, which is an established multidrug resistant marker. As I'm working with the patient samples, this is the approach I have adopted. First, I have selected the patients who have T1 to T4 stages of all grades and categorize them into pre-chemotherapeutic and post-chemotherapeutic setups. The chemotherapy that has been given in our hospital is FLOT regimen, which composed of 5-FU, leucovorin, oxaliplatin, and docetaxel. Next, these setups, these patients were again subcategorized according to the gastric cancer pathological subtypes, that is intestinal type and diffuse type. The tissue and bloods has been collected from the patients with their all consent and subjected to different histopathological and molecular analysis to see their expression patterns and how they are interfering with the chemotherapeutic treatment to develop the multi-drug resistance. Here is the two pathological subtypes of gastric carcinoma. When we talk about gastric carcinoma, we eventually talk about adenocarcinoma. According to Lauren classification, there are two subtypes, that is intestinal type and diffuse type. The patients with well and moderately differentiated types are categorized into intestinal types, which is generally arise due to the infection of H. pylori, and the patient with a history of gastritis. Whereas the poorly differentiated signet ring carcinomas are categorized in diffuse type. It is a familial kind of gastric cancer. After identifying the subtypes, that is intestinal type and diffuse type, the patient samples were subjected to the immunohistochemistry to see the expression pattern of sourcine and polyglycoprotein. Here in this setup, in the overall setup, diffuse type has a higher expression or a stronger expression for sourcine and PGP. And it has a statistical significant result. When we consider the setups, that is pre-chemotherapeutic setup and post-chemotherapeutic setup, we have seen in the diffuse type, the expression patterns are strong for PGP and sourcine in diffuse type. However, the expression pattern for sourcine and PGP has lessened in case of post-chemotherapeutic intestinal type. And here we can see that PGP and sourcine might be co-expressing together in the diffuse type. To confirm that, I have analyzed the rhodamine accumulation assay for PGP and selected the patients before and after chemotherapeutic treatment. In the baseline, we can see the rhodamine accumulation was high, whereas in the treatment groups, whether it is intestinal type or diffuse type, PGP is expressing highly in them. That means there is a probability of resistance. Here we can see in case of PGP, that diffuse type and intestinal type, both of them expressing the PGP molecule equally. However, to get back to the first slide, here we can see PGP expression only in diffuse type setup, which is this one. But intestinal type has expression before chemotherapy, but after chemotherapy, PGP expression was down. However, this result is contradictory and giving a very deflecting result. So we move to the protein expression and mRNA expression study. In the Western blot, we have seen that PGP is expressing highly in the post-chemotherapeutic setups, both in intestinal type of patients and diffuse type of patients. In case of sourcine, we can clearly see a significant expression in the diffuse type only when compared to intestinal type. As sourcine is also expressing in the post-chemotherapeutic intestinal type case, it is again giving a very contradictory outcome. So we have again get back to the mRNA analysis, where we have only chosen the patients who have got the FLOT treatment and have seen that post chemotherapeutic intestinal type and post chemotherapeutic diffuse type has expression for PGP, but in case of sourcine, it is only expressing in diffuse type, but not in intestinal type. Therefore, PGP is expressing both in diffuse type and intestinal type after chemotherapy. However, sourcine is only expressing in the diffuse type patient samples. Therefore, we can conclude here that sorcin is a marker or a multi-drug resistant marker for diffuse type gastric cancer patients and would have a role in chemoresistance, unlike PGP, which expresses after chemotherapy irrespective of the gastric cancer subtypes. Thank you.
Thank you. Our next speaker
is Tanuma Mistry. The title is ABCB1 polymorphism in tamoxifen treated ER and PR positive breast cancer patients.
Good evening, everyone. I'm Tanuma Mistry, working as a CSIR SRF in the Department of Pathology and Cancer Screening in Chittaranjan National Cancer Institute, Kolkata, under the supervision of Dr. Vilas Nasare. Today, I'm going to discuss about ABCB1 polymorphism in tamoxifen treated estrogen and progesterone receptor positive breast cancer patients. As we all know that breast cancer is the most commonly diagnosed cancer and also leading cause of cancer death in women. According to Globocan data, the mortality rate due to breast cancer was 13.6% in 2022. And breast cancer contributes 25.4% of new cases globally and also ranked as a #1 diagnosed cancer. The risk factor of breast cancer are as follows. We know that breast cancer is sex biased and it is more commonly observed in female than male. Other risk factors are like more elder age, obesity, and having a family history of cancer in first degree relatives, using of hormone therapy, late age of menopause, and consumption of alcohol and tobacco is also risk factor for breast cancer patients. The most commonly observed signs symptoms for breast cancer is having palpable breast lump and mastalgia. Other signs and symptoms are like itching, burning, nipple discharge, and nipple retraction, foul smell, etc. The main treatment option for breast cancer is surgery, radiation therapy, and chemotherapy. Most of the breast cancer patients are undergone for mastectomy or breast conserving surgery. Now I have choose tamoxifen. What is tamoxifen? Tamoxifen is a selective estrogen receptor modulator. It has high affinity to bind with the estrogen receptor. Therefore, it hinders the binding of estrogen with estrogen receptor, and finally, it hinders the recurrence of breast cancer. What is ABCB1 gene? ABCB1 is a transporter. It is also known as multi-drug resistance protein. It is highly polymorphic. The polymorphism of SNP is responsible for the accumulation for the efflux of drug. Therefore, it is responsible for adversity in the patients. I have studied two SNPs in breast cancer. Those are RS1128503 and RS1045642. The study design is we have selected 50 breast cancer patients according to the inclusion and exclusion criteria. And after that, we have subdivided the patient into two categories. The initially operable cases are undergone for adjuvant chemotherapy, and the inoperable cases undergone for neoadjuvant chemotherapy, followed by surgery and radiation therapy. After completion of the treatment, during the treatment, we have collected 5 ml peripheral blood sample from the patient, and this is subjected for genomic analysis. After completion of the treatment, the patient are prescribed tamoxifen 5 mg orally daily, and I have taken 4 follow-ups. 0 is considered as a baseline, and 3 years is considered as an endpoint of the follow-up. We have taken clinical response by RECIST criteria, and we have subdivided the patient into 3 categories: responder, partial responder, and non-responder according to RECIST criteria. And we correlate the genomic data with this clinical response to find the adversity of the drug. Now the result section, the socio-demographic distribution of breast cancer patients revealed that most of the patients are falling under 41 to 60 age group. They are mostly illiterate and coming from the rural background, and they are mostly housewife or unemployed.
Surprisingly, they doesn't have any family history of cancer. The immunohistochemical expression of ER, PR, and HER2 are tabulated in figure 2. The HE staining of breast cancer patient of of infiltrating ductal carcinoma are shown in the figure 2. The gross structure of breast tumor after surgical resection are shown in figure 2. In figure 3, immunohistochemical expression of ER, PR, and HER2 are shown here. In figure A and C, positive nuclear expression of ER and PR is shown respectively, and figure B and D shows the negative nuclear expression of ER and PR respectively. In figure E, positive cytoplasmic expression of HER2 are shown in figure E, and same thing is shown in figure F for negative for HER2 expression. The response rate of the breast cancer patient is stabilized in table 3, where most of the patients are responder and 8% patient are partial responder and 6% patient are non-responder. Most of the patients are having a grade 1 to 2 toxicity, and very few patients have found for grade 3 to 4 toxicity. Now the overall survival of the breast cancer patient tabulated in figure 4. Now we have done PCR RFLP for ABCB1 gene. For 1045642, the amplicon size is 194. This PCR product is digested with restriction enzyme HPY1883, and we have found the following cutting patterns. The patient, those who doesn't have any cuts, that means those who have only 194 base pair are considered as wild type, and those who have only 162 and 32 base pair are considered as wild type, mutant type, and those who have all the 3 cuts are considered as wild type, mutant type. And same thing is done for 1128503 restriction site. And we found that in case of ABCB1 1128503, most of the patients are following under wild type mutant pattern, and in case of 1045642, most of the patients are found in wild type pattern. Now conclusion, the breast cancer patient with ABCB1 gene did not have any significant association with the response rate. The median overall survival achieved within 48 months, and furthermore, no statistical significance was found with the adverse event of tamoxifen. Hence, ABCB1 polymorphism may not be a predictive treatment outcome of patient with respect to hormone receptor positive patients. However, further investigation is required with larger sample size. Finally, I like to acknowledge CSIR for funding for the financial support. Thank you.
Oh. Thank you so much for the whole presentation. Thank you, sir. For the completion of this particular session, I would like to thank all of you, these doctoral students who have presented these topics, and also chairperson specifically who has spent their efficient time constantly for the screen. And thank you so much, ma'am. Thank you so much, sir. Officially, I would like to invite ma'am and sir for the memento. Kindly come on the stage. I request AK Singh sir to felicitate ma'am and ma'am to felicitate sir. Thank you so much, sir. Thank you so much, ma'am. Well, this will end up for the session. We'll meet for the dinner, the food.
Second is two. Third position for me also I have been तो जैसे दोनों काम को इक्वल एक ये नंबर 2 है, एक को देना होगा तो ये होगा, दो को देना होगा तो ये होगा, और ये दोनों एक ब्रैकेट और ये वेट सेशन के नहीं होगा, इस सेशन में सबके मिला के वेट होगा। अच्छा हर सेशन का अलग वेट सेशन में कितने होगा? तो आप एक करते हैं, एक देना होगा, एक और दो होगा, एक देना तो अगर दो देना होगा तो तीन और तीन देना होगा तो हाँ एक हाफ हाँ हाँ मैम एक ही बस ये इन्हीं चारों के मार्क्स लिख दीजिए बाकी तो रहना है और आप